thank her for her service. Linda was actually quoted in today's Globe and Mail. She's the Senior Clinical Director of Community and Primary Care at Unity Health Toronto, and she was talking in regard to the need to vaccinate, the homeless in the city. And, she did a great job here, and I know that her commitment to Toronto community housing certainly would have cut into the important work she did that she does for the health system downtown, and so just wanted to pay tribute to Linda. I'd also like to acknowledge that the land on which we were meeting today is the traditional territory of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat. And we acknowledge that Toronto is covered by Treaty 13 of the Mississaugas of the Credit. So we have a loaded agenda today because we carried over a number of items from the previous meeting. We have deputations on items 3, 8, 9, several parts of 9, as well as 10. And we have a presentation from city staff on item 4. And I think that Councillor Fletcher has indicated to me she would like to make a motion to move an item up. Councillor Fletcher?
Yes, Mr. Chair, I think we deferred the OACH. I think there's some deputations on the OACH. I'm not sure which other ones were deferred, but it's always good practice to do those early. I am noting that there are a tremendous number of interested tenants who are making deputations today, and we have a lot of really meaty items. I'm feeling like we might not complete, and I would like to suggest that should we be getting to that moment, that we would consider adding a meeting in so that we would end up with everything complete by the next board meeting, Mr. Chair.
Okay, so why don't I suggest that we move OACH up to item 5 to come after 4, where we have a staff presentation. Is that so? We move it up 2 items.
That's fine. Yeah, thanks.
Okay, so that motion has been moved by Councillor Fletcher, seconded by we'll say Marcel, and all in favor. So approval of the agenda. All right, so. Are there any declarations of possible conflict of interest? Okay, seeing none, we now have the next item is the confirmation of the previous meeting minutes of March the 24th, 2021. Can I have a motion to approve the minutes? Are there any comments? No comments. Moved by Councillor Nunziata, seconded by Uba. Thank you, Uba. All right, all in favor? All right, so that's moved. So, okay. Now, we have the annual review of the Tenant Services Committee Charter for approval. Do any members have any questions or comments on the charter? Okay. Seeing none, the only comment that I had is I took note of the items that are to be in private session, and we're going to try to stick to that as religiously as possible as they pertain to land transactions. They might pertain to litigation or pertain to employee relations. And so we're going to try to move as many items in the public realm as possible. So can I have and that's already worded in there that's already in the content of the charter. So can I have a motion to approve the charter? Moved by Francis, seconded by Marcel, we'll say. Okay, all in favor? All right. So now, moving on to business arising from the previous meeting.
And we have 2 individuals who had asked to depute in relation to these items, Mr. Chair.
Right. Okay, and so this is found on page 24 of our agenda. And the first deputation is on, I believe, item 11 on CCTV, is it?
Yes, that's correct. And
Okay.
it's Kathleen Dubé, and I believe Ms. Dubé is on the line.
Yes, hello, good morning, everyone. Thank you so much for holding space for my deputation. It's on item 3BN11, CCTV cameras. Acknowledging at the March 24th, 2021 meeting, TSC requested a report back on the cost to replace a CCTV camera and the number of instances where TCHC camera footage was used by TPS in recent years. The information provided in the communication from William Anderson is an average cost. On September 15th, 2020, I sent an email to TCHC as the provincial government announced increased funding for surveillance. It is so important that we are able to acknowledge, advocate, and action accordingly. Based on the limited knowledge, I am privileged to reside in a TCHC community that have working CCTV cameras. Why aren't all TCHC communities afforded working CCTV cameras? On February 6, 2021, I sent a follow-up email to TCHC given the increase in gun violence to please consider I put 27/7, but I meant 24/7, security in higher risk communities, acknowledging the limitations to existing budgets. This email was sent after our fall staff community experienced loss and another example of our TCHC community collaborating with TPS. When will the narrative shift? It is so important that we are taking existing laws around vulnerabilities and sensitivities into account. Acknowledging systemic and structural issues, how are we leveraging our knowledge to ensure we are actively building back better for our TCHC communities? We've heard from the past deputations that communities want less police. How are we redistributing power? How are budgets respecting communities and human rights? Building a culture of respect, care, and helpfulness will take time. Thank you so much.
Thank you for your deputations. Are there any questions of the deputant? Okay, no. Thank you, Kathleen.
Thank you.
The next deputant is Miguel Avatar Barale. Miguel?
Good morning, everybody. Can you hear me?
We can hear you. Good morning.
All right, thank you. All right, so I'm speaking on item direct in regards to the neighborhood officer plan. So in your page 1 on the list, it shows Region Park. Why Region Park? Because Region Park is a community considered to be targeted for this project to reduce violence in the community. We are not estranged to violence. We just have a shooting early this year again. And 220 Oak Street, my building where I live, and I'm the tenant rep of this building, I have witnessed so many actions against people's lives and et cetera. But the point I want to make here is that we have last year opening up a new service delivery hub model, the first one in the city of TCHC, pardon me. So we were told that we were going to have attached to this building permanently or part-time basis CSU officers to be on site to be available for people to come and chat about issues that relates to safety and community. So, and I know COVID-19 is here. We can't do nothing about it. So everything is dealt with by phone. But I am very sure that when we are able to meet again in public, I'm sure CSU officers will be available. And I asked, I think last week, if it's possible to know what will be the schedule of the officers if they are going to be attached to the building 220 Oak Street, because we have done renovations inside, and I think one of the rooms is specifically dedicated for a CSU officer. So also I want to ask you again, committee members, that the Toronto Police has already deploying body-worn cameras, and Councilor Nasiata is aware of that, along track history to ensure the accountability of law enforcement officers. The TTC has also approved the deployment of body-worn cameras for the special constable. So I wonder if TCHC, since are increasing in numbers, and we live in very troubling buildings, where mental health and violence and addictions have reached a level never expected in my lifetime because of COVID-19. The number of people in addictions has increased. The number of suicides have increased. So we really need help in this building. And I'm going to be talking later with John Krakovic about the service improvement delivery for 220 Oak Street. Thank you for listening to me, Sheila. So I want to work together, right? Ensuring that we have a good service for our residents and ensure that your plan is successful. How many minutes I have left? Hello?
It's probably just about time to wrap up.
Time to wrap up. Okay. Just want to let you know that I have a couple of videos where I have shown to upper management where Toronto police officers and CSU officers, when they go into units in the building, they're not wearing body-worn cameras. And I was awakened the other day at 1:30 p.m. on Friday, April 16, because there was a complaining noise made against me. So I just want to put into notice that if we can make sure that we have CSU officers instead of Toronto police officers patrolling the hallways, it will be much beneficial because people will know who we are, and they know that I am not a travel person, and I don't know why someone will complain against me. Anyway, I leave for you guys to decide with the legal department, but I think I have only 50 seconds left, and I think I said enough.
Okay, Miguel, thank you very much. Your concerns about body-worn cameras are noted. Do any members of the committee have a question of the deputant? Okay, seeing none. All right, thank you.
You're welcome.
Thank you very much. Right, so in regard to the items on the list of business arising, the recap of work in progress, are there any questions from members of the committee?
Yes, I do have a couple, Mr. Chair.
Okay.
Yeah.
Go ahead.
Item 4C, tenant engagement refresh. There is, thank you very much to Sheila Penny and her staff for breaking that down by area. I think we have more on the agenda under Sheila's report. But here we have a participatory budgeting was put on hold and will recommence in 2021. The budget is $800K annually. Mr. Chair, I'd like to ask that prior to that, we understand what that is and what it consists of and how much has been spent in the past and what kinds of things, et cetera, and what the process is for this participatory budgeting of $800,000, please. So I'm pulling that out.
Councillor Fletcher, where is, can you point that out to me, please?
Well, it's page 11. It's out of the minutes, but for me, it's business arising.
Oh, out of the minutes, because we've approved the minutes. We're looking at.
This is coming up again. The tenant refresh is coming up again. Okay.
Okay.
I'm going to flag that piece of the minutes in the tenant refresh.
All right.
And then I'm going to flag for the fire alarms. That's pretty interesting. So, and then, all right.
So why don't we deal with those?
Yeah, we'll deal with them under, yeah.
Under
ahead, sorry.
Why don't we address that under the specific items on the agenda under the operational?
No, that's fine.
Okay.
Yes.
All right. So
and then number 13, which is here, the briefing note is in camera, but I've asked that I get more information on that one. Right? Number 13. It's listed there, but
That's correct.
Right.
wasn't listed on the, okay, that's good. All right. Thank you.
Okay, so
The
seeing
other
nothing-
thing just
Yep.
is on the community safety unit demographics. Sorry, there was and I think probably we'll have to have not a committee, but just sit down with the CEO and some others to just sort out what, because this has been on the agenda so many times, and I don't think that the information that was requested is yet there. So I think that's an important thing to do, flagging that.
okay,
It asked what the demographics were after in the hiring, in the VRP hiring, and where people were recruited from.
okay. All right, so for purposes of, all right, so we're going to, this is the recap of work that's underway
Right.
and that has been completed. So we need to just receive this for information. Could somebody move that, please? I can't see the whole screen there, Dara. There we go. All right. Moved by Councillor Nunziata, seconded by, we'll say Marcel. Thank you, Marcel. All in favor? All right, approved. Next item is the Violence Reduction Program, Memorandum of Understanding and Funding Arrangement with Social Development Finance and Administration. And from the city, we have Serena Officer, Acting Manager, Community Safety and Wellbeing, who's going to do a presentation. And this is on page 35.
John,
Yes. Yeah.
don't you have an agenda item for a vice chair, or when's that happening?
We do not have an agenda item for vice chair at this point. Dara, that's right. That was, we discussed that.
So we haven't yet brought that forward because we were waiting for the committee to approve the charter, which would contemplate the vice chair. So we can bring that forward to the next meeting of the committee.
Oh, I
If
think
that's
we
the
can
committee's
do
will.
that today. We've already approved that. We might as well get everything in place today.
I'm in the committee's hands.
Well, I don't see that there's not a urgent need. We've moved on from the item of the tenant services charter, which needed to be approved first, and then I think as a point of governance, Paula, nothing's going to change. We'll just approve that at the outset of the next meeting, which may be sooner than later.
Yes, it might be sooner than later.
All right.
Okay, thank
Okay.
you. I think that it's unfortunate we didn't realize that when we did that.
Yeah,
charter.
but thank you
Thank
for
you.
raising
Yeah.
that. All right,
I
so
think it's important to have everything in place, but I can wait till the next one. That's fine.
I'll try to stay in the chair for the duration anyhow, so we don't need a vice chair in the interim.
Don't walk out on Yonge Street and have anything happen to you. Thank you.
Right, okay, so Miss Officer.
So, Mr. Chair, if I can just give a quick introduction for the item.
Yes, please, thank you.
So, Mr. Chair, the report and presentation that's being delivered to the committee today is in response to a TSC request for TSHC in the city to conduct a joint presentation, specifically highlighting the partnership and arrangement in place for the VRP. As you're all aware, we work in lockstep with the city to focus the work on specific areas, including connecting tenants to support, enhancing the integration of services, as well as focusing on service delivery. At this time, I'd like to introduce the speakers. So Nadia Gouveia is the Director of Programs and Partnerships at TCHC, and Serena Officer is the Acting Manager of Community Safety and Wellbeing at SDFA, and together they will jointly deliver the presentation that's been prepared to the committee. So with that, I will hand it over to Nadia.
Mr. Chair, I have a question, first of all, for the Acting COO. Thank you. It's this. Is this part of the funding that was established out of the VRP when we passed that and said we wanted to have the city review it and look for other initiatives, not solely the CSU? I'd like a clarification on that. John, you might not know that. Sheila would know that.
Yeah.
That's correct, Councillor.
So the total funding that we're talking about for these programs that are going to be introduced? Could someone tell me what that is, please?
So if you add these 3 initiatives, Nadia, do you have the total?
I'll pull it up.
130 or 100 and, let's just on, and what was the total VRP? Was it 2.5 or 5 million?
So this section,
The whole VRP, the entire VRP.
Give us a few minutes, Councillor, and we'll pull that.
Okay, Councillor Fletcher, we can come to questions on the whole program at the termination of the presentation.
Well, Mr. Chair, I'd want to establish that there was a VRP that was agreed to by the board in 2019, I believe, and that
correct.
it was a certain funding package. It was dedicated to the CSU. The board established that there had to be other dollars than the CSU, and I think it's very important that that's a critical part of the report. This isn't an initiative that was taken by TCHC and the city, as great as it might be. This was a board instruction. And now for the board to understand the level and depth of the funding for this project, I think that's the key thing for the board.
All right, well, so staff needs to find a little bit of information. Why don't we have these questions at the end of the presentation? We can ask, we'll go through the committee.
That's fine. Yes, that's
we'll
good.
go through the
I'm
committee
simply establishing the frame, and I think the report to the board should establish the frame, and it doesn't. So I'm a little disappointed in that. But
Okay.
let's come back to the frame after we hear this.
Right, okay.
Mr. Chair, if
Yes.
I could, I understand now what the councillor is asking for. She wants to know what was initially approved in 2019, what was directed to program, and how staff have actioned the fullness of that program, and we will provide that to the next Tenant Services Committee meeting. I understand what you're asking for.
Yes.
So there are...
And what I'm asking for should have been in this report. That's the basis of this report.
I understand, Councillor.
Right, so for purposes of the public audience, I think it's important that we go through the report and then we ask pertinent questions at the conclusion of the presentation. Okay, so we can proceed, I think, please.
So thank you, everyone, and thank you, John, for the introduction. Serena and I are grateful for the opportunity to present today. Although the program rollout was delayed by COVID in 2020, we are currently underway in beginning to build relationships and pick up traction in the VRP and YVRP sites. The origin of this City TCHC joint effort came following a discussion at the April 29th, 2019 TCHC board meeting. At that meeting, TCHC management was directed to collaborate with the City of Toronto Social Development and Finance Team, or SDFA, to create program enhancements to the original CSU-led VRP to ensure a more holistic approach to violence reduction in our communities. TCHC and SDFA staff subsequently collaborated to develop strategies for streamlined service delivery and enhanced community programming that would contribute to the VRP aims. Program background. At its meeting on June 5th, 2019, TCHC's board approved the co-developed enhanced VRP and directed staff to operationalize the updated program. Subsequent delays due to program adjustments around the restructuring and our focused COVID-19 response in 2020 meant the program and staffing rollout was not completed until December 2020, when the full CSC team of 8 was in place across the regions. 4 staff are dedicated to the original VRP program, and an additional 4 CSCs are dedicated to youth VRP sites. 3 safer community supervisors, 1 per region, were brought on board as of February 2021. As you are aware, the violence reduction program is focused on improving safety and security for tenants through a reduction of violence in the identified TCHC VRP communities. In addition to CSU-focused activities, we recognize that violence reduction requires a multifaceted approach that must include economic development and community and social support. TCHC and SDFA staff collaborated to develop strategies for streamlined service delivery and enhanced community programming that will contribute to the VRP aims. The plan enhancements were centered on three main areas: connecting tenants and households to supports, place-based demographic-focused service delivery, and better service integration and accountability. The program is directly delivered by TCHC and City of Toronto staff, and also through 3 community agency-led pilots to support innovative program exploration, including a housing unit takeover pilot in downtown East and a combined children and family services pilot that will support 50 individuals and families to receive supports annually through Delta Family Services. And through the Crisis Response Fund, we have also made funding available for tenant-led and implemented programming. The Youth Violence Reduction Plan. The Youth Violence Reduction Plan expansion was born from a recognition that some family communities with large children and youth populations also required additional support around community safety. Building on the Tenants First Youth pilot in Rexdale, which took an innovative approach to providing services to youth by linking outreach and engagement with access to services such as mental health and employment, the YVRP program layer was introduced. The objectives of the expanded youth pilot include supporting youth leaders to discover ways to change and improve their community, youth having access to employment opportunities, youth and families being supported to maintain healthy tenancies, and the roles of the city, TCHC, and community organizations in supporting youth are clear and coordinated. The program is focused on 6 clusters of 19 additional TCHC communities focused in the east and west regions of the city. These sites were selected based on data analysis of community safety statistics as well as demographic indicators. 4 dedicated CSCs were specifically hired to support the youth pilot expansion. Program coordinators and senior program leaders are currently being recruited to support the youth engagement and program implementation in the regions. Our summer program planning has been intentional about including and prioritizing VRP and YVRP communities, and this is reflected in the partnership with Parks, Forestry, and Rec for the summer and the 6th program. Additionally, in 2021, we will provide engagement initiatives for 20 to 30 youth at each site, resulting in 120 to 180 youth engaged by the end of the year. We will also connect 40 justice-involved youth to services and opportunities to increase their skills and gain employment. I will turn it over to Serena to speak to our partnerships and the program pillars of the work.
Thanks so much, Nadia, and thank you, everyone. Very happy to be here. TCHC and the city have taken, as Ms. Nadia mentioned, a collaborative approach working closely for the implementation of the Violence Reduction Plan. The most appropriate units and programs were identified to be engaged in supporting this work here at the city. So taking this strategic approach that focused on service gaps to elevate resources, to reduce risks, and increase overall safety and well-being. So in leveraging best lessons and practices, new and existing programs, and evidence to collaborate and build this integrated plan to achieve the desired outcomes within the 3 areas that Nadia has mentioned. We've prioritized how we can build our partnerships, increase engagement of residents and resident-led solutions, and within that, prioritizing the most vulnerable and at-risk groups. So through the Community Resources section, CRS, within SDFA here at the city, the following units of programs have been aligned within the VRP. So the Community Safety and Wellbeing Unit, which takes a multi-sectorial approach through programs that looks at mobilizing collaborative responses to critical risk, violence interruption and intervention, and coordination of vulnerable and high-risk persons, as well as community supports in response to traumatic events of community violence. The City of Toronto's Community Crisis Response Program, which leverages city programs and services and partnerships to develop supportive and collaborative, trauma-informed and culturally appropriate approaches when there's been critical incidents of violence within the city. The Youth Development Unit supports VRP through the collaborative assessment of youth and family needs within VRP communities to support the identification, development, and implementation of youth-driven programs and local community-based agencies. The Confronting Anti-Black Racism Unit at the city will also and continues to support alignment of the VRP through program design support, training, data sharing, and analysis, with the aim of ensuring inclusive access and support to services for Toronto's Black population using ABR lens. Another unit that we, recognize that needs to be a part of this key integration and response is our Tower Neighborhood Revitalization Unit, and they are responsive to also mitigating risk in a particular way for residents. This unit engages residents, community organizations, and building operators to drive broad environmental, social, economic, and cultural change by improving Toronto's concrete apartment towers and the neighborhoods that surround them, and in particular, in this case, in the downtown east. So each of these are working with VRP staff closely to support the 3 key pilots that we'll be speaking more to, and Nadia has started to mention this morning. Okay, I'll continue. The city's CABR unit supported the shaping of the strategy within TCHC, which included the training of VRP management staff. And CABR will continue to provide trainings as needed, policy advising support on applying anti-Black racism lens to the work and approaches, committed to any additional community consultation support needed through the fostering of connections between TCHC and CABR's partnership and accountability circle and the CABR Council Advisory Committee. Next slide, please. What I'll speak to now is the program pillars. So within this is a focus on 3 key deliverables and particular outcomes. So the first is connecting tenants and households to supports. So this is identifying vulnerable tenants, seniors and youth in crisis, and connecting them to appropriate support. So by leveraging existing models and tools to identify residents through TCHC's Tenancy Resolution Office, Focus, and Spider, we've been able to look at the increased number of tenants referred to partner agencies, leveraging those tables, including increased access for tenants to get access to the supports that are most necessary and most needed. Focus and Spider has continued during COVID, so there has been impact to our service delivery, but we've been able to continue virtually and have been able to see an increase in referrals in 2020 across most tables, and most of the referrals coming from CSU and the tenant access and support unit, and what we're seeing here is, top risk factors that we were able to be responsive to: mental health, crime victimization, basic needs, physical health, antisocial and negative behavior, and across all tables in Focus, we've been able to mitigate risks approximately on average 84% of the time in situations. An example of our ability to be responsive is to think about how we extend maybe boundaries of our tables to be inclusive of VRP sites, including an example of Focus being extended to include Lawrence Heights. Coordination with training for staff to increase awareness and capacity for streamlined referrals is happening to both Focus and Spider tables. There are TCHC representation both there, very active, and city staff work closely with these units at TCHC to ensure that streamline is happening and those referrals are happening as well. Place-based demographic focused service delivery is our second deliverable. And this looks at Focus staff in these particular areas with tenants to develop and implement local solutions to address safety concerns. We've mentioned 3 targeted pilot programs, which I'll speak more to, that looks at leveraging our partnerships to enhance access to the most appropriate services. And so we've been able to increase tenant participation in capacity building activities related to community safety, leading to increased tenant leadership and increase in tenant-run safety initiatives. So our opportunity here has been to have dedicated, staff in these VRP sites, which allows for a focused approach with the staff. Not only that, but with investments to support resident-led, community-based and driven solutions, increase leadership through local safety networks, continues to support the development of best practices and protocols on the ground, and the most appropriate supports and services to address safety concerns in real time. The team works closely, again, with CDOs, which are community development officers with the city, to support those immediate responses to escalated vulnerability of violent incidents and coordination of interventions. The third is integration. When we're speaking about integration, we are looking at better service integration and accountability, so improved service coordination and communication amongst the partners, in particular between the city and TCHC. So what we look at here is the ongoing opportunities for coordination for localized efforts, which includes refining our membership and partnership with Focus and Spider. So the opportunity, TCHC being very active at those tables, is engaging over 130 community-based partners, which strengthens those relationships, the communication, and those streamlined referrals and direct referrals in community for that collaborative intervention. We have ongoing information sharing, so information sharing around trends and key opportunities for engagement, and integrated trainings, meetings between city and TCHC teams. So that includes our community crisis response program and other relevant units within TCHC that are represented in the VRP as well. And this helps to enhance and support local protocols and, again, collaboration for service delivery. That's most impactful. I'll speak to the programs, the pilots, and the programs more specifically next. Next slide. Thank you so much. So as mentioned, the city leveraged existing partnerships and program models to identify, who the best partners were to engage for service delivery and solidifying that partnership through MOUs. So as Nadia's mentioned, there's been 3 pilots, and these agreements have allowed for focused support in VRP sites with existing local partnerships and expertise. So it's very localized and community informed and driven. Integration with existing city investments and elevating collaboration and coordination between our agencies. Again, the impact of COVID has been significant on our partners and community partners across the service delivery, and with families as well being able to access support, and it has pivoted priorities in order to meet basic needs. But we'll look at each. So Delta Family Services, this is the pilot that looks at working with parents and young people that are most at risk, age 10 to 15. So those supports include workshops, managing youth behavior, one-on-one supports in identified households, which also provide case management. So what are some of the program highlights are the creative referral pathways that ensure that TCHC tenants receive the priority access to the case management, to the services, in particular mental health services. And modules for the family support program have been finalized as well. And so within this pilot, there are 3 key objectives here. Increase parent and caregiver awareness of protective factors that can be initiated to support youth through training, for example, and through that case management offered to the family as a whole. Secondly, increase parent and caregiver skills as advocates and case managers for young people in their lives and in their households. And third, increase parent and caregiver access to support programs and services that reduce vulnerability to serious violence and crime. Although the impact of COVID, there have been staff that are now hired, and families have been meeting weekly and regularly to discuss needs and get access to the supports that they need. The pivot that I made mention to is in regards to, with the impacts of COVID, pivoting to making sure families are able to get access to the basic needs that they have that have manifested and surfaced during this time, and getting those met first, and then being able to layer in these additional supports and case management opportunities. Canadian Observatory on Homelessness. This is our pilot in the Downtown East. It's in collaboration with the DREAM team, developing an integrated public education training and coordination protocol for tenants, agencies, and security safety staff to increase awareness and prevention of housing unit takeovers. HUT is what we refer to as. And this is specific to the Downtown East. This is the unit with the City Tower and Neighborhood Revitalization that is leading the Downtown East Action Plan that this aligns with. So using that data and using the information to inform the work along with TCHC staff, it's looked at working with SSHA from the city, the DREAM team as mentioned, and Toronto Community Housing CSU. So what I'd like to highlight here is just the key component here around leveraging the lived experience of the DREAM team, which is a peer-based nonprofit organization dedicated to advocacy, education, and research in areas of supportive housing, mental health, discrimination, and stigma. So many of the folks in the DREAM team that are members of the DREAM team, have lived experience in living in supportive housing where they've experienced maybe even HUTs themselves. So what's happened so far with this is that there have been 3 out of the 4 scheduled community consultations completed with over 50 participants. We have 47 stakeholders engaged and 23 registered for their training as well. One of the things that have been impacted is the very critical component of developing and establishing trust and the relationship with those units who may be a victim of HUD. And so that continues to be an ongoing process. And this assessment is critical to being able to identify these units. And so right now, we've been able to identify 10 to 12 units that may be victims of a unit takeover situation. Next, I'll speak about the Community Crisis Response Fund. So this is a fund to facilitate access for residents to support initiatives and projects, safety projects that address trauma, capacity building, and community healing. What we did here was we took, again, practices that were best learned from our Community Crisis Response Fund that the city does have, and heard from community and the expertise of TCHC staff as well around what those specific nuances and needs are in TCHC communities. So the need for not only interventions, but also in response to incidents, but also the additional resources that are needed for prevention activities. So taking those lessons learned, the best and promising practices, taking these direct investments through VRP sites increases the opportunity for residents to access the funds, to mobilize local community-based and led projects and initiatives that prioritize local needs and responsive to improving safety and well-being for residents. So on average, each year, what we've seen at the city is applications that we've approved between 27 to 35 each year. Approximately of that, 10 to 12 are from TCHC specifically. So with this $40,000 investment, residents can receive up to $2,500 per application, and we expect up to 16 projects will be funded. Tenants will be able to deliver short-term programs, training, events, focusing on violence prevention, community healing, and trauma supports. So there's ongoing direct outreach that's happening with tenants, tenant groups, through the local tables, and directly with TCHC and city staff leading that within each district. And the application process right now closes on May 21st. We don't anticipate the money not being spent, as we know by practice and by what we've seen in terms of evidence. Monies do get spent with these projects and initiatives each year.
Miss Officer?
Yes.
Could we move on to the program highlights sort of quickly, and then if you could just quickly wrap up in terms of what's ahead, that would be great.
Yes, I'm done. I'm going to pass that over to Nadia for the next piece.
Oh, okay. All right. Thank you.
Sure. So as mentioned at our VRP sites, CSCs are actively building relationships and have been setting up local programming despite COVID. They have been innovative with creating online spaces for adults and young people to talk about safety, and as a result have been able to connect with 460 individuals, in addition to supporting critical COVID initiatives such as the vaccine rollout. To better support service coordination, the teams have been implementing integrated team meetings internally with CSU and other divisions, and with stakeholders externally, including the City of Toronto. Regionally, as outlined in the slide, we've engaged over 200 tenants in the West around food security and safety planning, 55 tenants, Dan Harrison in Central, around safety and security survey, and over 70 individuals in the East have been connected to employment, mental health, and social service supports. So looking ahead, we will continue to work closely with SDFA in rolling out training in the pilots. This will include further alignment and refinement of our focus by the referral process. We're currently working on a partnership with Toronto Employment and Social Services in the East region that will have caseworkers in the community so tenants can have direct access to support. The YVRP CSCs are working to ensure that youth can access summer employment opportunities both internally at TCHC and externally through partners. So overall, we've made efforts to adapt and adjust to the changing environment COVID has presented us. The regional teams have worked tirelessly to connect tenants to services where they could. There are many opportunities ahead, and we look forward to having an expanded impact in the community the project serves. Thank you.
Okay, good. Thank you very much. I will now take questions from committee members. Uba, please.
Thanks, John. Thank you both for providing this comprehensive report. I am really happy to see all these services that we're going to have for tenants. My quick questions are we going to hire some tenants to participate all this? Number one. Number two, are we going to provide this communication and this, update that you make in different languages? Because a lot of tenants don't speak English. And if I may just comment on what the previous debatant did, I have similar concern. We have seen a lot of gun violence, and the summer is not here yet. And that's a concern for everyone, definitely a concern for me. And I'm wondering, this is great. We're gonna have all these pieces, the social development, the programming, the commerce and everything. But at the same time, we need to increase, and I don't know what we have to increase, to be frank with you. It's just something gotta change here, because we're doing a great work, and I appreciate each and every one of you what you're providing, but still the gun violence is continuous. Still people are losing their young sons. The future of this country is in jeopardy. So I don't know if Sheila, you can speak to that, but I thank you very much for your report, guys.
So if I could respond to that, Mr. Chair?
Yes, please.
The work that Nadia and Selena outlined is embedded in the region. I just want to make that clear. Nadia, as our Director of Program and Partnerships, works with the city, designs locally, designs centrally, and then we execute locally on those programs. So each region has a community safety and support manager who has safe community supervisors, CSCs, who roll out all of these various programs locally. I recently joined a community safety advisory committee that has TPS, public health, the city, SafeTO, SDFA, the school boards are just coming on board, and jointly we recognize that it's the beginning of May. Summer is coming. We are prioritizing communities that have a high incidence of gun violence across the city through those various city services to see what each of us are bringing to our respective communities, to do a gap analysis and work together to fill the gaps. So I just want to provide some context. The work that Nadia and Serena highlighted is delivered locally through the region, and we are also at a city table with all of our partners, identifying which communities we expect to need support to respond to increased gun violence and how we're going to do that.
Okay, good. Thank you. Any further follow-up, Uba?
I appreciate Sheila, and I notice I manage a housing project, so I notice what a great work that has been taken and continues to happen through different tables, whether it is crisis response or whether it is the focus and what have you. It's just that it's when you see 51 homicides, and we're not even in the summer, and most of it happened, to be honest with you, in our property. It's just you just pull your hair and say, what can we do more to prevent that? Because intervention is a great thing, but it's a bit too late if we are in that stage. We need to prevent this, and I appreciate all the work that you do, guys.
Thank you. Any other committee members? Marcel, please. Marcel, your microphone is not on.
Sorry.
There you go.
Okay, start again. I was just looking at the 2021, looking ahead about providing ongoing services for people trauma with losing young people to suicide and violence. Have you thought about who you're going to partner up with, or looking at different types of training?
So those programs are done through the region. So we typically work with local partners. So if you have suggestions, we'd be happy to receive them. I can get the exact partners list from the regions, but that's typically how we do it. It's not citywide partnerships.
Okay, because I've done some work before with bereaved families of Ontario. They do one-on-one supports, but they also do groups for for sudden death and suicide loss. And they also provide training. They can actually train staff to help deal with the crisis. That's it. Thank you.
Thank you. That's helpful. I've made a note.
Thank you.
Thank you.
Any further questions from committee members? Okay,
Yes, I do, John. Sorry, I do.
Councillor Fletcher?
Yeah, back to the original, and thank you for talking about that at the beginning, Nadia, that was part of that. But I'm still back to my original question, and I think we've had time to determine basically all the costs, because now I'm really interested in the total costs. These 3 grants that we're looking at, I think they're only just in the 140,000, 150, something like that. But the number of staff that you're talking about in doing all these things, there's a large cost here. And one of our roles as the board is to oversee all of that. So I think the programming sounds really great. But I want to determine the costs. Is it within that VRP dollars? But Sheila, you can confirm that amount. And then I don't see anywhere how we're going to measure the impact. So number 1, what's the overall cost for the VRP? Number 2, how much of these dollars for these programs is coming out of that original allocation? Number 3, if it's not coming out of that allocation, how much is it and where is it going? Number 4, how are you measuring impact of all of these tables and your ideas? And number 5, I'm all with Uba on, and that's about measuring again. So those are my 5 questions. And I think after your presentation, I'm sure that John has had a chance, or Sheila has had a chance to get those answers for me. Thank you.
Michelle, on the program cost, do you have that?
So the 3 pilot programs that are referenced in the report total 175,000, but I will need some time to pull all of the staffing costs, the CSCs that are assigned to the original VRP sites, to the expanded sites, and to layout for the committee, reference that back to the program dollars that were approved in as part of the 2021 budget. So,
and the original allocation. So
right.
I just think that we always need to have that alongside of the reports, Mr. Chair. Just here's the costing.
The costing, and then Councillor Fletcher, you also asked about sort of about targets and how, you know, what are they aiming for in terms of numbers and
measuring in the impact.
Measuring
how
the
we
impact,
measure the
right?
Impact for the
How do you know? In other words, how do you know what success looks like, right?
So we actually report quarterly through the VRP update. So later on in the agenda, I think it's 9G. There's actually a VRP update, which includes CSU indicators as well as this component of the program. So right now we focus on 2 indicators, one of which is the number of referrals that are made through this particular social service enhancement. And the second item we report on are the number of tenants that we've worked with or engaged with. So if those 2 indicators don't get us to where we need to get to, then we can modify those. But that's coming up in the later report.
I see. Okay, thank you. Yes, and then I'm just going to go back, Mr. Chair, to what we are going to get in July or June, I believe, which is, as I've talked about quite a few times, and I think the committee supports it, dividing our communities. And I know there's 330 of them now, because that's exactly 330 minus 83 because the seniors are out. But the number of TCHC communities, and having a lens that says stable communities, and stable communities that have the odd amount of violence, then communities that are very full of violence, and then communities where there's a lot of mental health and addiction issues and extreme poverty. So once we have that delineation, then I think it's much easier for us to understand how these programs apply, because it helps the board. So I'm looking forward to that, Mr. Chair, and then we kind of nest things within that those descriptors and focus on how we're going to assist and just be part of the lives of tenants that are simply living in stable communities that don't have these issues, but what are great programs that everybody could access. It's a little different way of thinking about things, but I am very clear that I think we boil the ocean all the time, and we need to be able to segment things. Thank you, Mr. Chair, for allowing me to make those remarks.
All right, do any other committee members have any questions? All right, so I need a motion to receive the information from staff. Moved by, there we go. Okay, now I can see people again. Okay, moved by Councillor Nunziata, seconded by Uba. Okay, all in favor? Thank you. And thank you, staff, for the presentation. We look forward to updates in the future. All right, so the next item, we've reordered the agenda. The next item we're going to go to, it's on page, found on page 86. And that is OACH, the Office of Housing Equity, and the annual report. And Miss Summers is here. There she is. Good morning, Cynthia. Still
Good
morning.
morning.
Right, okay. So you're going to make your annual report. There is you've got the report there. We'll take the report as read. And if you could just speak to the highlights, the impact of COVID, how you've been affected, what you've been able to achieve, and what you're looking forward to going forward, that would be great. I don't know if you wanted to go through it slide by slide, but in the interest of time, it would be great if you just spoke to us with your knowledge as the director of this.
No, that's fine. I'm happy to do that. Thank you. Good morning, everyone. I'm pleased to present to you the 2020 OACH annual report. What I thought I would do to organize the information is simply give you a really brief overview of the audit findings in regards to the work of TCH, and then give you a very brief overview in the highlights of the work of OACH for 2020. I know that the second agenda item is the 2020 work plan, but in fact, the information overlaps. So I think what I'll do is simply address both reports, if that's all right, Mr. Chair.
That's fine. Perfect.
Okay. So starting with an overview of, let me start by saying that 2020 was a challenging year for everyone. However, the work between OACH and TCH, I think it's been one of the most successful years we've ever had. And I'll talk more about that when I talk about the work of OACH, but essentially the two, OACH and TCH, worked really collaboratively. We were very flexible, and I think everyone would agree that we were very creative in finding ways to serve tenants during this difficult time. In regards to the audit findings, in regards to the work of TCH, basically there were small changes from 2019. For example, when looking at arrears collection process errors actually decreased by 7%. So a marginal amount, but meaningful amount. Loss of subsidy errors increased a little bit, again, coincidentally by 7%. But I think there's reasons for that. To a great degree, in both of those statistics are slightly affected by the fact that COVID was happening. TCH referred more files to the Office of the Commissioner of Housing Equity, but more importantly than the numbers, there was a real opening up. You'll see in the report discussion about the pilots. It really opened up the communication between the two offices, and there was a trust developed between the two organizations where TCH was relying on OACH to perform more audits, and they were, if you look at some of the numbers and you think, oh, that number is a little off, or be sure to consider the fact that TCH almost opened its vaults. So there were some old arrears. There were some tenants who'd been struggling for a long time, and for whatever reason, they weren't referred in the past, and they were referred last year. In fact, this has led to really positive changes this year. One of the pilots has resulted in TCH approaching OACH this year and asking us to do an overview review of all arrears files that are about to be filed with the sheriff to ensure that we can do a second check to make sure that all the principles of fairness were followed, all the arrears processes were properly followed. So it's another protective layer for tenants before the sheriff is called and their tenancy is ended. So that's a really direct positive outcome from 2020. And finally, in regards to TCH, I would say that they've really made an effort to be partners with OACH, and the executive and management team's been fantastic and really reaching out. But I have to do a shout out to the frontline staff, and in particular the superintendents, because during COVID, OACH's success can be credited on the OACH team, of course, but we really relied on the superintendents to support us with the tenants. And I've never seen us work more closely. So I think that's an overview, and I'll leave it to questions later in regards to TCH. In regards to OACH, I'm sure you've reviewed the report. I'm always really pleased and always a little surprised at the really positive outcomes. You know, you get into the work and you do your best, and at the end, miracles happen is what I tell my team all the time. Even though we were in the middle of COVID last year, 338 households were stabilized. Now, even during the period where there were no evictions being actioned, people were at risk of losing their houses as soon as the COVID restrictions were lifted. So these are 338 households who were willing to work with OACH, even though they weren't at imminent risk, but they knew that there was a future risk. 83% of the households OACH worked with resolved the arrears. We've done that with the frontline staff at OACH only partially being out in the field. As of July 2020, they went back into the field, but they limited to where they need to meet with the tenant. Otherwise, the superintendents and other people are supporting us to communicate. And of course, telephone, good old-fashioned telephone's been a big help. If you look at page 13 of the report, you'll see the numbers regarding the recovery of repayments of monies owed. Predominantly tenants and the City of Toronto, but there's other factors on team 14 or on page 14. 196,900 was paid directly back to TCH as a result of the OACH intervention, and 980,000 in arrears were managed by local repayments. And then the resolution of loss of subsidies resulted in a further 434,000. That's not the main focus in my work, but I think it's important to the organization to demonstrate that not only are we working with tenants to meet their needs and to ensure sustainable tenancies, but that there's actually a financial benefit to the organization. The final thing I'll say about the OACH work last year, and I think it's demonstrated in the case studies, is that OACH continues to employ what we call the OACH approach, which is actually how we work with tenants and how we earn their trust. And it's certainly an earning situation by listening to them, by providing them with resources to deal with underlying issues, and by providing them with wraparound services. Finally, coming out of 2020, there's been so many positive outcomes, I think, for tenants and for TCH and OACH. One is that OACH has been invited by TCH to engage and work with them on their rapid rehousing program, on their with their tenant resolutions office, to, like I already spoke to review all arrears evictions. And my final comment I'll make is I was really honored to be invited by the seniors unit to participate in a seniors housing conference that's taking place on May 11th and 12th to talk about the OACH approach and to talk about our engagement with tenants. So I just want to end this by saying thank you to TCH Thank you to the tenants who chose to trust us last year during this terrible pandemic. And thank you to the OACH staff, the frontline people who went out and gave these great results that so positively impacted the tenants. So with
Okay,
that, if there's
very
any
good. That's great,
comments.
Cynthia. Thank you very much. All right, so I'll just I'll take questions from committee members. Any questions from
I
committee
just
members?
have one question. Yes, John.
Councillor
Councillor
Fletcher?
I'm noticing that in a number of in some of the case studies, I guess I just want to underscore the importance of a third party, that sometimes tenants that get into rent arrears and trouble are very, they're almost frightened or concerned to talk to staff directly. Has that been your experience? And they kind of need that third party who can intervene on their behalf. That's one of the trends that I'm seeing here.
Yeah, yes. I think that sometimes OACH is able to get through the door because OACH is arm's length from TCH and the frontline staff that they've worked with. But I think that could be resolved and that issue addressed if the frontline staff had were given the opportunity to get the skills and to provide an approach that builds a relationship at the front end. In some cases, the relationships have broken down and COVID didn't help with that situation. But certainly it has mattered that OACH has been able to say, well, we report to the board of directors, so we're a little different. However, I think as time goes on, that's a reaction to a problem, whereas frontline staff could employ the approach of OACH and could develop the skills.
I'm not so much talking about the ability of staff. I'm talking about and maybe that's one of the things that we need to ask the tenants that are coming to OACH as to why they feel comfortable there. And they're a little less comfortable going to TCH, because if they get turned down, then that's the end of the world. So sometimes it's just very helpful to have basically an advocate to try to resolve things with the staff. It's not so much staff competencies, it's got to do with just concern. You know, people are renting, they're always afraid of being evicted. Everybody right now is on super alert to eviction.
No, I do agree with you, Councillor Fletcher. They see OACH as an advocate, and within our team meetings, for example, at OACH, we often talk about the fact that within 5 to 10 minutes, we need to approach the tenant in a way that they know that we respect them, they know that we're going to listen, and that we're here to help them. And that is definitely, that messaging matters. And in fact, I was shocked, even positively shocked, over the 2020 and into 21 time period that the early resolution officers have been able to establish this relationship predominantly by phone. We often
And can I just ask you a second question then that has to do with how many, in the past, we've looked and seen that sometimes the staff at TCH are reluctant or not as quick to send the cases over to you, and then they start dragging on. And I think you'd indicated that working with Sheila Penny, that you're making progress in that area. So is that percentage changed in your report?
Yes, it has. It's up from other years. And definitely Ms. Penny has been a huge positive influence in that regard. And the other thing that I tried to allude to is that not only is it that the numbers are going up, but TCH is making a concerted effort to look through their portfolio and find referrals that perhaps, quite honestly, should have been made 2 years ago and making them now. So in some cases, the arrears might seem high, and they are high, but now they're coming to the OACH, whereas 2 years ago they weren't referred to the OACH. So I
Thank
see a
you.
dramatic change in I don't know what word to choose for that, but I think there's a real commitment to working with OACH and for OACH to work with TCH. We're being brought in.
That's
That's
great.
good.
I really appreciate that. Thank you.
Any other committee members have questions? Okay, I have a question. I don't see any from the other committee members. Cynthia, I've got a question. What's your annual budget?
It's about 1.4, and that, I mean, I'm not looking at the budget, but that is all staff with the exception of about $55,000 for operating costs, I believe.
Okay, and in the detail, it says repayment agreements comprise most of the arrears recovered. What percentage of those repayment agreements are actually paid?
Well, it's interesting. We've looked at, we're just now, there's a new process now where we're being advised when these repayments are paid off, which is fantastic. But what we've done is we've looked at a 1-year period. We check on all of our repayments. Basically, what we're finding is 30% of them have one breach, 70% of them are not being breached. So I think that's a good number. I wish it was a higher number, but the reality is we're dealing with people with mental health conditions and vulnerabilities.
So when you had, for example, in 2019, 868,000 in repayment agreements, do we track as to how much of that has actually been paid back?
Certainly TCH does now. In the past, the way that I've measured that is there's a process in place where if OACH brokers a repayment, if it breaches, TCH must send the file back to OACH for one more intervention. So we've at OACH have been tracking that. And generally what we found is 30% of the files come back as a breach. That doesn't mean those monies are lost, because what happens is OACH will rebroker an agreement. We'll look at what are the underlying issues and why did our repayment fail, and then rebroker it.
Okay.
So it's
And
not
then-
a perfect science, that's for
Right.
sure.
And then in loss of subsidy, are there recurring themes as to why the loss of subsidy occurs? And where, I'll just let you answer that. Are there recurring themes as to why the loss of subsidy occurs?
Yes, basically the challenges with the loss of subsidies are often communication between the tenant and between TCH. So for example, a tenant may fail to provide information to their frontline worker that they need to calculate, or the numbers are incorrect. You'll see in one of the case studies, the actual numbers, the arrears created are incorrect. So it's about contact. If you look on page 19 of the report, two of the main issues are contact and reminder letters. So one of the challenges is that tenants struggle to fill out the annual reviews, and they really don't, particularly with seniors, they struggle when they're turning 65 because they don't understand that process. Now, pre-COVID in 2019, OACH went out and did training with seniors on how to complete the form and what the rules are around the form. But that's the biggest challenge, is they really don't understand the process, or they don't feel comfortable communicating the information.
Okay. All right, thank you. Thanks for the presentation. Thanks for your work. From the committee then, we need two motions. First, we need a motion to receive the OACH annual report, and then we'll require approval for the performance report. So can I get somebody to move receipt of the annual report? It's moved by Councillor Nunziata, seconded by Marcel. All in favor? And then approval of the work plan performance report, moved by Uba. Thank you, Uba. Seconded by Marcel. All in favor? Great. Thank you, Cynthia.
Thank you.
Right. All right. Next item on the agenda, found on page 60, is the corporate goals for revitalization. And Sheila, did you want to?
Sure. Happy to.
Okay.
So if we could put up the attachment, it's a summary of the content contained in the report that I'll speak to. Kaylee, if we could put up the attachment 1. So this is a report that was referred from the March 19th Tenant Services Committee. At that time, Kevin provided an overview. He was responding to a request as CEO for the ELT, the Executive Leadership Team, to take a look at broader corporate goals and objectives for our revitalization program. Given that we now have a fully funded capital plan, the initial goals of the Revite program were to leverage land value and replace buildings. With a fully funded capital plan, we're able to broaden our scope. Many of these values, goals, and objectives have been guiding TCH revitalization over the last 15 years. You'll see some newer pieces that are being introduced so that we can continue to provide good guidance to Revite as they go forward. We have formalized the values, goals, and objectives that are contained within the report, and the team is working on identifying measurable success factors. So that is still a work in progress. I won't spend a lot of time going through values, goals, and objectives. They're there for the benefit of the committee. You'll see some new and old pieces picked up and incorporated, and myself and Vincent Tong, our Chief Development Officer, are here to answer any questions that the committee has.
Questions from committee members? Sonia, if you could just take that, thank you. Any questions from the committee members?
I just want to speak on that.
Okay, I have a question. Sheila, and so we'll do questions and then we'll do comments. So Councillor Fletcher, you can comment after I ask the question.
Yeah, absolutely.
You talk about, and I know, Sheila, this is a passion of yours, high quality buildings and design features that are inspirational. In some of the revitalization projects that have already occurred, have you, what change, are there changes that you've seen, and maybe you could describe the changes in sort of the life of the community?
So I think, and I'll ask Vincent to jump in here as well, but from my perspective, what I have seen in the Revite communities is a blending of market units with our rent geared to income and affordable units. And I think that that is a very positive step forward for the company, that when you walk through Regent, when you walk through Allenbury Gardens, when you walk through pieces of Lawrence Heights, you don't feel the difference between an RGI building and a market condo building. It feels like a cohesive community, and for me, that's a real key success factor. Vincent, did you want to add anything?
Yeah, I'll just jump in there really briefly. A lot of the buildings that we've been developing over the last 15 years in Revite communities, you know, we strive to kind of build on lessons learned from previous buildings that we built. So a lot of tenants provide input into our designs. For example, early on in Regent Park, you know, we built a lot of units with open concept kitchens, for example. And then when we heard some feedback from some of the residents that were moving into those buildings, particularly Muslim women, they didn't feel comfortable with an open concept kitchen because, you know, when they were cooking, they had to remove their headscarf, or they couldn't remove their headscarves. And so now, as part of our design, we incorporate a blend. So we'll provide some closed concept kitchens, some open concept kitchens. And so that's kind of a little bit about, you know, when we talk about building design, we're responding to feedback from tenants, but we're also responding, we're also trying to be innovative in terms of the buildings that we're building.
And I was thinking that's a great example. Thank you. I was also thinking of a reduction in antisocial behavior. Is that,
I mean,
do
that's part of it as well. I mean, we try to not rebuild buildings that have, we try to conform to SEPTED principles, crime prevention through environmental design principles. We try not to have line corners in the hallways of buildings, for example. So the shapes of the buildings, we try to have them as fairly simple forms so that you don't have those blind spots, so that there's some clear sight lines.
Okay, thank you. Councillor Fletcher, you wanted to speak.
Yes, thank you. Thank you. I'm going to ask that BIFAC get this report because it actually talks about the 3.4 billion, that there's a fair amount of money that, having received those monies from the city, quite a large amount, and other levels, that there's this other money. And I think that that's kind of their job to think about, here's the money, what does it look like, how much, etc. So, Mr. Chair, I am asking this to be sent there for their consideration as well, around the dollars, please. That's the first thing.
So this is for Councillor Fletcher. This is for information only. There's nothing for approval here, and this will go to the full board, of which, of course, BIFAC.
Okay, that's fine. Then we could do that, and then they might want to take that. I understand. Okay, thank you for that, Mr. Chair. Then I just want to say this, that to me, one of the things with revitalizations, and Mr. Tong just talked about the kitchens. I found it very interesting that when the board approved Firgrove, that the tenant directors voted against it because of the street grid being reintroduced. And there's a notion that that increases the drive-by shootings in the community. That's something we've never talked about or dealt with. I am concerned that in the revitalized communities, which to me is more about, it might be about being able to replace the buildings because they're old and we are having them replaced at no cost. But the notion of what does revitalization mean for the community in terms of violence, the levels of violence that are maintained in some of our major revitalizations is of concern to me, Mr. Chair. That would be at Regent, that would be at Alex Park, that would be at Lawrence Heights in particular. And I don't find that we're kind of fessing up to the fact that we've built new buildings, but we're still grappling with a certain level of violence in the community that is of great concern to the tenants who are living there. And to my mind, what steps have we taken to figure out why that's still happening, to revitalize the tenant experience as well, not just with the buildings? So I don't know how you'd like to deal with that, but I'm raising that today because I'm concerned.
All right, thank you. Okay, that was not a question to staff. That was a concern that you raised, correct?
Well, yes, I'd like to know you to give some direction as to how we're going to get at that around the revitalized community. That actually is the role of Tenant Services Committee, to be looking at whether it's the VRP or other types of things and actually measuring what's happened. Maybe I'm wrong, but that is not the impression that I have or many others have as well.
Sheila Penny, thank you.
If I could offer, one of the goals for the Revite team is to identify measurable outcomes coming out of Revite, and I think that gun violence could be a measurable that they put their attention to in that structure. We are in the process, the councillor spoke about staff understanding who we have living in our communities. And there's a significant amount of work underway to pull that data, to assemble that data for the Community Safety Advisory Board. But I think in regards to gun violence in revitalization communities, Vincent, that is something that the Revite team could pick up, cross-reference with data sets that we're pulling for all communities and provide as a measurable, something you want to have your
Well,
focus
what I
your
want is before and after. So
Yeah.
I know from Donmount, there was far more gun violence after the revitalization than before at Donmount in Rivertown. And I can't speak for the other revites. The other thing is just the tenancy management and understanding what's happening. I'll also say that when we had Fir Grove residents come to city to speak about the Fir Grove redevelopment, one of the young men said, "What you have to take into account where you are moving me. Because if you put me in the wrong community and I'm from Fir Grove, now I'm a target." And I just think there's these elements that are outside of beautiful buildings and all the rest of that, where the streets are, where everything else is, that's the tenant experience. And I want to measure these things for the revites.
So as I said, we are doing that across the portfolio, and we can work with Revite to provide a subset for the Revite communities.
And I'll move that at the board when we have this, but I'm very clear. I don't want every building. I want what we've done in Revites, because we have a counselor who is apoplectic about Lawrence Heights and the amount of violence in Lawrence Heights, which is an ongoing revitalization site. And Councillor Nunziata can confirm that, because I think she seconded some of those motions. That's all.
Okay.
I think that's the last piece that we
That's
haven't done yet, Sheila. Thank you.
That's a good point. Thank you, Paula. That's good. I agree. All right. So,
I believe, John, Councillor Nunziata has a
oh,
question.
sorry. Yes, Councillor Nunziata. I was just looking down. Sorry, go ahead.
Yeah, sorry, I just want to make a brief comment about the revitalization of certain communities. Is what's really important, because I know I'm working with TCHC as far as the Falstaff community. And when we say we work with the community, I think it's important that we work with the community at large as well, the residents that live around our TCHC buildings. And with the tenants, there should be a partnership, because what's happening in some of these communities is that there's such a stigma, in our buildings, that we need to get that partnership with all community members, that, we're working together and trying to revitalize certain buildings. I know I'm trying to do that at the Falstaff community, because there is a lot of stigma in that community. I just recently had a meeting with Parks and Rec on a future proposal for an aquatic center. I don't know, Sheila, if you were able to come to it, but the residents that did attend, very, very negative comments, like actually disgusting comments that were made about the tenants that live in our building, and which I was just shocked, very angry about the comments. So I think it's really important that we get the whole community engaged. It's unfortunate, but in some parts of the city, there is that stigma, and people that live around our TCHC buildings do not want to be part of our, TCHC buildings, which I find it very difficult. I just wanted to make that comment.
Okay, thank you, Councillor Nunziata. All right, so
I have one more comment then, Mr. Chair, if you don't mind, very quickly. Thank you.
Quickly, please.
Thank you. I'd like to say that in the Rivertown revitalization, that people moved into Rivertown specifically to support this new type of mixed community. They're very clear about it. Because of the amount of violence in the newly refurbished community, I've had letters from people moving out because a bullet went through the window where their child was sleeping. and that there is just this, what have we done? So I think for a revitalized community, because we're introducing new elements, we're introducing non-TCHC residents, that piece is really high, should be much higher on our agenda than we've ever had it. Just flagging that again after your remarks, Councillor Nunziata, because we've gone from riches to rags there. Thank you.
Okay, a motion to receive this item on the agenda, corporate goals for revitalizations, moved by Councillor Nunziata, seconded by Marcel. All in favor? Thank you.
And Mr. Chair, just to confirm, the intention of the committee is to forward this to the board for its information as well. Is that correct?
Yes. Yes,
Okay.
please.
We've reflected that in the motion. Thank you.
All right, so next item is found on page 66, 65 of the agenda, Lawrence Heights Phase 2 and 3 Tenant Benefit Agreement. And this is for approval. And Vincent, are you going to present this and make comment?
Yeah, so thank you, John. So this is a report that TSC had requested that the development team come back with, where we would present the community benefits agreement to TSC for consideration before the phase 2 and 3 RFP was released at Lawrence Heights. So this report responds to that request. And before I pass it off to William Mendez, who's the Director of Program Delivery, to kind of just run through some of the highlights of this report. The approach that we're taking with Lawrence Heights is very similar to the approach that we presented for Regent Park phases 4 and 5, with some slight modifications. One of them being that the community priorities report will come before the issuance of the RFP. So with that, I will pass this off to William Mendez. Will, if you wouldn't mind just putting into presentation mode, or Sonia's sharing screen. Thanks.
And if we could go through this, fairly rapidly, and then get the questions put forward, that would be best. If we could do that, please.
Okay, thank you. Good morning, everyone. The RFP process is governed by procurement, and we have developed a robust consultation process to inform the creation and scoring of the RFP and the securing of tenant benefits. Through the RFP process, developers will provide proposals and responses to the tenant benefit categories, which will be informed by the tenant engagement process. I'll speak a little bit about the tenant engagement process in the upcoming slide. Before we release the RFP, we'll create a tenant priorities report that will inform criteria within the RFP and will be provided to the proponents. To ensure that community priorities are reflected in the evaluation of the developer proposals, the RFP team will work with the Lawrence Heights Revitalization Ambassadors to co-create the scoring criteria for community engagement and community economic development sections of the RFP. Working with the Revitalization Ambassadors is important because the RFP team, comprised of TCHC, TO, and city staff, will be able to better understand the priorities, solutions, and context of need within the community. So the developer RFP scoring, within that, proponents will be invited to present their proposals to tenants on tenant engagement and CED or tenant benefits to the community. Tenants will be able to rate the presentations as part of the developer selection process. The RFP team will score the submissions and would be able to use their lens of community issues, which they have learned through their work with the Revitalization Ambassadors. The proponents will be required to provide flexible tenant benefit targets so they can be further negotiated and formalized in a tenant benefit agreement. Once a developer has been selected, TCHC will consult with tenants and work with the developer to formalize the tenant benefit agreement. This will include hard targets such as jobs, including apprentices, training and scholarships, targets for social and local procurement to support social enterprises and tenant businesses, and other direct and indirect investments. In addition, we will formalize a monitoring and evaluation framework to regularly communicate progress towards the hard targets. This is very important as the tenant benefit agreement will help drive the social changes as part of a 10-year implementation plan. In a parallel process, TCHC will create partnership tables to progress work in key areas which will complement the tenant benefits agreement and address tenant priorities. Next slide, please. At the core of creating the priorities and benefits agreement is tenant engagement. We will provide regular and consistent information sharing and hold engagement processes open to the community. When developing and validating the community priorities, our goal is to consult with a minimum of 700 tenants. We officially launched this process in April with 2 virtual meetings, and we will have ongoing consultative engagement processes until the tenant priorities document is complete and the RFP is ready for release. Tenants will be involved in the decision-making for the developer presentations and through the revitalization ambassadors co-creating the scoring criteria for specific sections of the RFP. And tenants will also will make decisions on how the community should be engaged in the comprehensive planning process, also known as the master planning process. At this time, I welcome any questions from the committee.
Okay, thank you, William. Questions from the committee members?
Yep, I have questions. Sorry.
Okay, Uba, please.
Yep.
Thanks, John. Thank you so much for this update and report. It's really great to see that 700 tenants were consulted, and we're going to provide apprenticeship and scholarships and employment. That's great, and I really appreciate it. And are we going to provide this information different language? That's all I want to know.
Yes, to answer your question, we will be providing information in multiple languages, as well as our ambassador team is comprised of people who speak different languages in the community.
Okay, thank you. Councillor Fletcher?
Yes, just directing to page 74, please. And I'm going to need more information about that. That's the summary of current tenant benefit agreements and the number of jobs achieved. One of the things with revitalization is the goal that, Sheila, when you presented that, of course, the economic development side and the long-term economic advantages that we can make sure tenants get, because these revitalizations are worth hundreds of millions of dollars to the developers. So just on this list then, when it says 35 tenants employed, 11 full-time, 24 part-time, I'm going to need, I think it would be helpful to have this, Mr. Chair, so we really understand the nature of the jobs. Are they still jobs there? What were they? Are they minimum wage jobs? Are they full-time career jobs? What is the situation? Because the staff have laid this out very nicely as far as the Allenbury, Leslie and Imark, which is the same project, Lawrence Heights, Alexander Park, and Regent. And I guess as well, Alex Park and Davenport. Then we also have the Regent Park, it's there. So is that possible that we can get that, a clearer breakdown of the long-term economic benefits to have tenants in long-term stable employment?
So if I could just before staff answers, if I could just point out that the indication to me is that the jobs are not permanent full-time. They're full-time for the number of months indicated in column 4 while the project is ongoing. And then I'll let.
I'm sorry, what are you looking at here? I'm sorry.
So in column 4, it shows the number of months of full-time jobs. So yes. the jobs are full-time for a period of time, and then once the project concludes, the person's employment, in what they were doing, comes to an end. And I'll let staff comment further.
I'm sorry, I have a different impression, so I'll be clear before staff comment that there may be those types of jobs during the development and construction, but there are jobs in the community. There may be city jobs, there may be parks and recreation jobs, there may be library jobs, there may be Sylvie's jobs, there may be Royal Bank jobs, there may be construction jobs that people have become an apprentice and built that. Those are long-term full-time jobs that the revitalization would deliver for tenants. And I understand what you're saying, Mr. Chair, around maybe animators and others for those kinds of jobs. So I think we should break those out. Our goal is to create jobs while this is going on, but when it's over, you want stable employment. I want stable employment. I'm sure we all want stable employment after that time.
So if I could just maybe quickly respond to that, Councillor. We completely agree. I think the objective of the community benefits and community economic development is long-term stable employment for residents in these communities. The table that is in the report, though, the majority of the jobs that we're providing are through our partnerships. So they're mostly construction related. They're through our development partnerships with our development partners. In some instances, like early on in Regent Park, some of those jobs that are listed were from employment that were found through some of the retail that located into phase one. It would be hard for us it's going to be difficult for us to get that specific information because
that's okay.
Regent Park is tracked by Toronto Employment Social Services. They manage the employment program for Regent Park. But in some of the other communities where it's construction related, we're more than happy to provide more details around that employment for you.
Yes, I'd like to have that. Thank you. So that's for Allenbury, Leslie Nymark, launch sites, Alexander Park, Davenport, and A Park number 2. That would be helpful. I appreciate that. Thank you. Good. We're good.
Okay.
I'm good.
So motion to approve.
Do I need a motion to do that, Mr. Tong, or how are we going to do that?
We're happy to provide the information directly to you, or if you'd like us to bring this information back to the committee, we're happy to do that as well.
Should be interested in that. I guess then, Dara, you would put that on as an
action item.
Yes.
Correct.
Okay. Thank you. Thank you very much. I'm good.
Okay. So we're back to the original item then, and the recommendation is to receive the report for information. So moved. Moved by Councillor Fletcher, seconded by Uba. All in favor. That motion is carried and item received. Next item on which we have some deputations. Item 8, which is the Seniors Health and Wellness Hub at 145 Strathmore Boulevard, Greenwood Towers. This item also had been deferred from a previous meeting, and so we have 3 deputations.
And the first deputant is Kathy Birch. I believe Ms. Birch is on the line.
Hello, can you hear me okay?
Hi, Kathy. Good morning.
Good morning. Good morning, Mr. Chair and committee members. I'm Kathy Birch. I'm the chair of the RPATH committee. Let's get right to the issues. RPATH has had minimal conversations with the senior housing unit over the Wellness Hub reported on page 6 of the report. I want to be clear, we fully support additional programming being made available to seniors in the new corporation. Here are our objections, not just concerns. TCHC delivered an accessibility project in the community room space in June of 2019 worth hundreds of thousands of dollars. As part of any accessibility project, RPATH and Facilities Management delivered 2 tenant engagement meetings. This was delivered as a normal part of the design and engineering process for the project. At the first meeting, we learned many things about the community that felt were important, particularly the stage area and the exercise areas were very important to this community. We delivered a design that is accessible and that maintained these 2 spaces. The new Wellness Hub takes both of these same spaces away for agency spaces. The surveys that were provided to tenants were not transparent in advising tenants on how physical spaces would be affected by this Wellness Hub. The physical plan from the information provided as recently as last Friday, April 30th, is to turn the stage into an office that the seniors housing unit has not confirmed the number of staff that would need to use and that would not be able to provide the Toronto Community Housing Accessibility Build Standards turn diameter within the office for tenants and employment, even if it's a single staff person. Yet the seniors housing unit is planning to take the space from this community. Across from the proposed office are currently the stage, is what is proposed to be a medium activity space that is currently where the exercise equipment is. This is exercise equipment that was used regularly pre-COVID. This is exercise equipment that tenants bid for via PB processes and that TCHC spent thousands of dollars on. There's not an approved plan or options to relocate the equipment because there's truly no additional space available outside of the community room that could be made accessible. Nor are there specific uses for the medium activity room identified by the seniors housing unit to ensure that it is truly accessible and available for all tenants and the greater community to participate. Current free space available in this community is non-existent. As it is, there are laundry concerns that still need to be addressed in this community. Every foot of this community must be planned with specific purpose. Because the agency would have control of the community room, accessible kitchen, plus the proposed agency spaces during business hours, it leaves no room for any pre-existing tenant activities, such as the English classes they had to have in the community room. Our path provided a possible solution to this specific issue over this past weekend that included input by the tenants in the community. We were not included in this prior to last Thursday. What SHU, the Seniors Housing Unit, did do was go to Greenwood or Wood Green first about the idea that we put forward about how to make this work instead of going to the tenants first, which I find really, really offensive. This community already has safety concerns because there are security guards posted in this building. What happens when you bring in even more people from the greater community? I have not seen any meaningful way additional security will be provided so far in this proposal. Finally, let's talk.
30 seconds, please.
Finally, let's talk about the money. The Seniors Housing Unit said that the agency will provide 50% of the funding, and we've not seen any of that in writing, so we don't think that Toronto Housing should proceed with any design or construction without that money being finalized.
Okay,
Our
Kathy.
issues are not minimal.
Kathy, your time's up. Thank you. You've made some good points. We're gonna.
Excuse me, but there was 24 seconds on that clock. I'm looking at it.
Clock I was looking at was down to 1. Do you have another couple of seconds? I'll give you another. If you have another couple of sentences, please go ahead.
We're not contesting the need for more programming. What we are protesting is the lack of transparency to the tenants and to the community that's being affected, and they should have the option to object to even having this hub. Thank you.
Thank you. All right. Questions from committee members?
Yeah, I just have a question for Kathy.
Councilor Fletcher? Yep.
Yes, just about the role of RPATH there. What is your role since you were brought in now?
We were brought in because, especially when you're designing spaces, to ensure the accessibility for people with disabilities, whether and how it might be affected. For instance, security is affected because if you add additional doors, they need to be accessible. People need to be able to get through them. If you're going to move rooms around and make sure that Toronto community can, not only the tenants can participate, but they'd be able to employ somebody with a disability. So we're brought in to look at all, because accessibility touches so many aspects, we need to make sure that we can truly be an inclusive community, and that's why our path is brought in.
I see. Thank you very much, Kathy.
Thank you, Kathy, for expressing your viewpoints. Next deputant, Bill Lohman.
Yes. Good morning, Mr. Chairman, Ms. Penny.
Good morning.
And am I on?
You're on. Go ahead, please. You've got 5 minutes.
Thank you. Good morning, Mr. Chairman, Ms. Penny, and committee members. Thank you for the opportunity to present these concerns to the committee for its leadership and judgment. My name is Bill Lohman. I live in one of the 83 senior buildings, and I am a member of the Senior Tenant Advisory Committee. I'm also a past member of, I also used to live at Greenwood Towers. My voice is my own. I participated in the hub meeting with the stack that's being cited in this report, and I have to say that I can appreciate that we all see through different lenses that shade our perceptions. And this report is sort of skimming the cream off the top to make a story more appetizing while ignoring the spilled milk as it sours. I recall being part of a more spirited conversation, like why are there only 5 hubs? Where will they be located? Where is the list of agencies and nonprofits available to serve the 83 buildings? Why wasn't the stack included, etc.? But there was one emphatic point that every member agreed to, and that was that hubs should not be located in actual seniors buildings because of the very things that you're talking about here now, because agencies take space and they create security issues by having people come in from the outside. Security's been an issue with Toronto housing forever. Let's have some honesty. It's like we're living in 2 sets of books, a tale of 2 cities, one written up and packaged nicely and in line with expectations and accountabilities for bosses, while the other is a growing reality for seniors communities that is playing out right now at 145 Strathmore. And what's occurring is exactly what every seniors community has said they do not want. Agencies in their buildings denying access and controlling the common space that tenants have on their lease that give them access to it. And it's overly obvious that the tenants here were not informed clearly, if at all, about the massive intrusion, security problems, and invasion of privacy that these vulnerable senior tenants would face from outside agencies, bringing their clients into the buildings and the drug-addicted transients and criminal elements of the neighborhood coming into the community's living space after years of fighting to keep them out. There's been a total lack of candor with the 83 buildings about their future since May of 2018, when the senior separation was announced. And it was concretized in July 2019 when staff told seniors they were no longer part of Toronto housing and that there was no supplemental budget for seniors. Now, notwithstanding COVID-19, senior communities have faced a wall of silence for 1.5 years and some longer. So I think it's, I went to the mayor, I made a statement to the mayor's executive committee and about the efforts of Toronto Housing's engagement refresh to connect with seniors, that it stopped in 2019. And the refresh model did not and does not take root in the 83 buildings. And so with that in mind, it makes no sense to continue to implement something that will be removed in 2 years, as many other things. So I think it's important that we move forward with an initiative for seniors where they have an actual voice in the creation of their engagement model. And I think this is an opportunity to do that. And I spoke with Joe Bada yesterday, and it was a meeting that we'll be having with Julio Rigoris tomorrow, in which I hope to see where senior needs can be integrated into the refresh model. So as members of the Tenant Services Committee, I believe that you're tasked with overseeing and ensuring the design, implementation, policies, initiatives, and reports about tenant communication and engagement. And I would hope that you would follow up on the inconsistencies between what is being written in reports and what is being reported by tenants on the ground and by those who know different. Thank you very much for listening to me today.
Thank you for making your points, Mr. Lohman. I will turn to committee members for questions.
Yeah, I have a question.
Councillor Fletcher.
Yes, this does say it's a seniors health and wellness hub, Mr. Lohman, not a community one. So it is directed particularly at seniors. Is that your understanding?
Well, yes, it is. But I used to live in Greenwood Towers. It was the
I
first
understand,
building
but you said it was general. So I just want to clarify that it actually is a seniors hub.
Well, if that's the impression that you got from me, Councillor Fletcher, I apologize. I am speaking as a senior about senior issues.
Okay,
So,
I did get that impression.
so if I did not click, yeah, thank you.
Thank you for clarifying that. So this is a seniors hub for the seniors in the district to go to. And on page 138, it says the staff members demonstrated support for hub opportunities, but emphasized they need to reflect tenant input and to be considered equal partners in their implementation. Are you telling us that your experience, you're advising us that you don't think that's happened here, Mr.?
Yes, ma'am. That is not happening here. And it is not happening in many other seniors buildings. Now I can elaborate on there and give you
I just
examples.
don't know where the other hubs are. We're only talking about this hub. We're not talking about the other ones today, as you know, right? Is this hub?
Yes, we are talking about one hub, but what happens in one hub will have an effect on what happens in other hubs. And the issue here is about the transparency with the tenants in regards to what is coming into their building and what they have not been told.
Okay.
I'm hearing you. I'm basically asking you this question. Are you against having hubs for seniors in any of the 83 buildings? Oh, that's my question.
I believe that any seniors building that does not have a way of cutting off access to a hub that might be in that building, if there is no way to cut it off to ensure that the seniors in that building have safety and security, then the answer is no.
So your main concern is people coming in from outside, other seniors, because this is only seniors, and the staff who will be associated with that provider, in this case Wood Green, that the building should be selected somehow that's a discrete location that.
The issue is, and I know this from living in Greenwood Towers, and because you do not have somebody at a door 24 hours a day, that you do not have control over who is coming into the building. You cannot guarantee that it is only the seniors, because these buildings, when a door opens, everybody who wants to gets in. And Councilor, I think you know that from previous examples.
I hear that. I'm just thinking, and I'll speak to that it might make it safer. That's the only other thing. And thanks for answering those questions.
Thank you. The deputy. Thank you, Mr. Lohman, for making your views known. We have another deputy on this item, Janet McLeod.
Yes, I believe Miss.
It was a classic sales pitch at 145 Strathmore. Getting a customer to say yes repeatedly makes it harder to say no. And who would say no to more services and programs and activities in your seniors buildings of 351 units? But at what cost? In responding to questions in the door-to-door focus group, responders state they had no idea it would mean loss of recreational space we were accustomed to before COVID, or that it would mean admitting strangers. They state vehemently if they'd known, they would have said no. Now, Bill and Kathy have reviewed some of our security concerns. We do currently have one security guard for two main entrances a block apart, 17 floors. When he shows up, or he's not on break, or he's not having his lunch. Visitors have many ways of getting in, and Bill has indicated that piggybacking is an ongoing issue. With other people coming in, even if they are seniors, we have no idea who's who and will have lost any hope of better security, identified repeatedly as the #1 issue for our building. This so-called poll itself, it is a conflict of interest that the group who stands to benefit financially from the Wellness Hub service provider, Woodgreen, is creating the open-ended questions, asking tenants for their opinion and making their own handwritten notes. Woodgreen's questions were, would you like more programs? Do you exercise? What would you like to see in the building? Respondents confirmed they were never told this would mean surrendering space they'd enjoyed. English speakers were interviewed at their doors. Chinese speakers were called on the phone and questioned how Woodgreen obtained their numbers. Our own experiences with Woodgreen services have had mixed results, and we certainly were not involved in choosing that agency. Chinese speakers say they state a preference for the return of Grace Chan's Eastview Community Centers programs, but they weren't asked. The Greek community reports they were totally excluded from the focus group. Tenants say they prefer using the exercise equipment more privately from meeting space and having it available day and evening. We use the rec room and kitchen for such activities as tenant-run holiday parties, barbecues, holding meetings, and small get-togethers when we can't invite family into our units because of bed bugs. Tenants ask, what about the pool table and our participatory budget-funded ping pong table? They remember being on the first floor and being able to use the toilet. As always, housing claims that tenants were involved at every step, but the reality is skewed to housing's agenda. Our role is peripheral. Tenants state they were deceived and are very upset. As per Councillor Fletcher's building meeting, May 29th, 2019, we are okay with what Joan White and Jaipreet Kohli stated. Staff in the former Don Valley East Beaches OUL offices, to include our valued new SSC, Renee Sauer, plus other support personnel. Those offices are a separate, self-contained space, yet accessible for outsiders as well. Additional activity and medical check opportunities that we ask for would be welcome for the people who live here. On the grounds that there was a conflict of interest in Woodgreen doing the survey, the fact that our repeatedly documented priority of security has been swept aside, the absence of ramifications of more activities taking up recreational space we use, and heaven help us, more money thrown away on areas only 2 years ago nicely retrofitted, our Greenwood Towers Tenants Association, speaking for our building, has agreed that we do not want the Health and Wellness Hub in our building coming through our entrance at all, despite a notice posted today that the hub is coming and will be located in the current community room with services offered to tenants and the region as a whole. I submit this on behalf of the association as well as the co-chair, Christina Stancati.
Thank you, Ms. McLeod. Questions from committee members?
Yes, I do have a couple of questions for Ms.
Councillor
McLeod.
Fletcher.
You're quite concerned about the level of intruders that are in this building because there's entrances from both Danforth and Strathmore, as I understand it. And you've got quite a few people that end up coming in to partake in things that aren't necessarily seniors things, drugs and other things, Ms. McLeod. Is that correct?
Partially. We are indeed extremely concerned about outsiders coming in. There are two main entrances a city block apart from each other. No human being can do both at the same time. Plus, we also have 5 other entrances, 2 of them on Danforth and 2 on Strathmore and 1 at the garbage parking lot. Yeah, they're coming in.
And you do have a fair number of incidents there? that
We
you've
do
advised
indeed.
the police and CSU of, and somebody jumping out a window and having a drug deal and nobody taking that seriously? Is that what happened?
You're
recently?
exactly right. It's in my written deputation, but I was afraid I'd run out of time. Which I will
That
submit.
incident there. So this has been a worry for the tenants at this building for a long time. I'll ask the staff about exactly what's going to go on here, and I think we need to have a site visit. Okay, thank you.
Thank you. Any further questions from committee members? None. Okay. Well, actually, I would like to ask a question, if you may. Janet, are you still there?
Yes, I am.
Janet, there's going to be no change in the security, and there's no change in the doors, the number of entrances as a result of this. So, and this is a seniors hub, which is designed programs for seniors. So are you concerned that seniors from the neighborhood or other TCHC buildings will be coming in and causing a disturbance?
Absolutely, because I'm sorry to say that some of our seniors tenants are participating in a proliferation of drug activity. Yes. How will you know when a group is coming in an accessible door who might be going legitimately to a wood green program at in our nearby recreation room, but they have to walk through the building to get to the accessible entrance? How do we know who's who? How would a security guard or 3 security guards know?
So you're suggesting that seniors might be coming in and dealing drugs?
They do already.
Okay.
Yes.
All right. I'm not aware of that, but I don't.
Oh, yeah.
That's my. Thank you. Okay. Thank you. For
I
that
will add
information.
that we have often CC'd our concerns to Councillor Fletcher's office, and she is obviously aware and has identified some of our concerns. Yeah.
Okay, so thank you for your deputation. Thank you for your comments and the answers to the questions. And now we're going to open it up to. We're going to open. We'll go to staff. I don't know if the report has always been read. I don't know if we need comments from staff, or we'll just go to. I think we'll just go to questions from committee members. Councillor Nunziata.
Just the staff. So there are a number of benefits for this hub, correct? To provide services and programming to the seniors in the building that is lacking.
So for you, Mr. Chair, it's Jill Bada. Yes, that's correct. There is a significant amount of additional programming that this center will bring to both the tenants and the community.
So right now, you don't have any programming, and by bringing in the hub, it would benefit the seniors that are living in that building, and as well as other seniors coming into the building, correct?
So just to clarify, there are some programs available, but on a very limited basis. So there's no question that the specified programming through this center would enhance opportunities for health and wellness and community interaction with both tenants as well as other seniors in the community.
So have the seniors in the building in the past asked for additional programming and services in the building?
So as the report identifies, and I know there have been some comments today, we did undertake a significant amount of engagement with tenants through at various times in the development of this as a result of the executive committee at the city's direction about the hub creation. We've done focus groups. We have done, as you've heard, door-to-door surveys with each tenant in the building if we could reach them, and other engagement activities. And there has been, certainly a significant comment from tenants that we spoke with about the recreation spaces not being utilized a lot of the time, about the opportunity and the desire to have more programming that would help reduce social isolation, as well as making sure there's more equitable access to programming for tenants in the building and in the community.
Thank you.
Councillor Fletcher?
Yes, thank you. You said you'd done the survey, but apparently Wood Green did the survey. Or could you confirm who did the survey for me, please, Ms. Bada?
Yes, so the tenants, the focus groups were conducted by seniors housing staff with tenants in the Southeast seniors buildings, to be specific about this region, because this is our first hub. The door-to-door surveys were done with both seniors housing staff as well as Wood Green. And as I say, we knocked on all the doors of the building and actually were successful in speaking to 140 tenants. And also we have had conversations with the senior tenant advisory group about the concepts of the hub and some of the potential programming that could be included.
So just tell me what the programming will be, please. Give me a.
So the programming that we had planned for.
What has Wood Green been contracted? What has Wood Green been contracted to deliver? Because they've been contracted now.
So to be clear, we're still finalizing our agreements with Wood Green as part of this report. But some of the identified programming we are talking about with them are things like health promotion workshops, computer literacy and digital literacy classes, exercise and physical fitness, things such as choir and music. There is interest in a rainbow club for the LGBTQ seniors, knitting classes, card games and clubs, language classes, different cultural celebrations.
Which ones are they is in your contract to deliver? Because you've contracted them to deliver something. That's a long list. Are there particular ones that you're signing off on?
So all of these would be included as programming opportunities within our agreement. As I say, we have not finalized that agreement yet, but these are the ones that are being outlined for opportunity in the site, as well as things like cooking in the community kitchen and cultural celebrations, I should just say.
And this is for all the seniors that in that grouping of buildings, 80 Danforth, 717, 3330 Danforth, etc. Just for those.
That's correct. It's for the 18 buildings in the Southeast region, as well as seniors in the local community.
Oh, as well as seniors in the local community. So non-TCHC residents.
That's correct. That's as per the executive direction, our executive committee direction that we received.
Okay. And other thing here is this building, as you and we've done the workup, has significant safety concerns that many of the other seniors buildings do not have. Number of police times, CSU visits, drug interactions, a whole number of things. And the majority of the building is actually bachelor apartments. There's 300 of them in the 390, which creates a different type of residency. So I don't know if you've addressed that in any way, the security issues, particularly if people are coming from the street. Basically, senior can just come in the building, and you've got a civ. Its building is a civ at the moment, so I don't know what other steps are being taken here in the introduction.
Maybe I could share, Councillor, that we did evaluate several buildings in the Southeast region as potential locations for the hub. There was 5 that we did look at. There was 145 Strathmore, obviously. We looked at 3330 Danforth Avenue, 80 Danforth, 717 Broadview, as well as 1420 Victoria Park.
This is about
we have done as a result of. I'm sorry.
No, this is the question. All as far as the security around this building is concerned, it is probably is the worst for intruders of all of the buildings that you're identifying.
So there was a security analysis done by community safety as part of the evaluation of the site. They did not identify any major concerns or issues. What they did recommend as part of the review, which is part of our current plan, is that we would manage access to the building for people coming in to take part in programming. And that would involve the hub staff through Wood Green and seniors housing staff being on site to support door access in and out during programming. And so there wouldn't be just, a free entry in and wandering about circumstance. So people coming in for programming would be met at the entrance and then escorted out as they leave. And as many are already aware, we also have 24-hour security already in place in the building. And so those are some of the outcomes of the community safety review from a security perspective. And those are the recommendations they put forward on how we would manage access, particularly for those coming in from outside the building.
Thank you for that. I'm sorry to take so long, Mr. Chair, but 717 Broadview actually has a discrete building is owned by TCHC. Wood Green rents 721. It has a discrete zone that is for seniors participation, I believe, for frail seniors. Why was that not looked at for the hub and taking that back, having Wood Green run those programs out of there?
So as I mentioned earlier, Councillor, there were several things that we looked at as we evaluated each of the buildings that I referenced. One was obviously the physical space available, availability of things like washrooms and kitchens, proximity to transit, access to parking, access to outdoor and garden space, green space, and also, quite honestly, the physical location of this center in the region itself, because obviously it will service all the members of TCHC seniors in that region, in the Southeast region, as well as community. And so the other thinking was that through those assessments, that was how Strathmore was determined in terms of the 5. Those were the considerations that we looked at in determining that Strathmore was the best choice of the 5.
I see. Thank you. Thank you. I'm just going to speak for a second, Mr.
Okay,
Chair.
I've got a couple of questions first, please. So we've heard from 3 deputants who are unhappy that this hub is being located in the building. Are they just a vocal minority, or are they representative of a wider concern of residents in the building?
So I'll be honest, I think it would be important to acknowledge the comments that have been made by the deputants. They are, obviously expressing an opinion, and in a couple instances, opinions of others that they represent in the building. We did, as I say, we feel confident that we've gone out and had a number of engagements with both tenants in this region, as well as others, about the programming. We recognize that any time that there is going to be a compromise in terms of shared space in a building, that it is challenging. It would be challenging for any resident of any building. We're working very hard and are continuing to firm up those plans through working with partners like RPATH and our own facilities team to make sure that we are going to have things like tenant access to these spaces outside of programming. So as an example, if a couple of tenants wanted to sit down and book tea every Thursday from 1 to 2 p.m., we'll make sure that those arrangements are made so that tenants still have access to the space during the day and not necessarily having to take part in programming.
So how do you envisage the programming to roll out? Will it be from 4 to 7 every day? Will it be 5 days a week, 7 days a week? Will it be, 3 mornings and 3 evenings a week? Has that been planned out?
The current proposal is that it is daytime programming during the 5 days of 5 core days of the week.
So
during
that's
the day hours.
Is that 9 to 5?
Basically, yes.
So if it's 9 to 5, somebody can't really book a tea with a friend or a family member if it's all being programmed.
Yes and no, as I say. The discussion we've had with Wood Green is that because there will be calendars with everything scheduled for the programming in the center, we will put forward through our staff to them the fact that we have, tenant programming desired for a particular space, and we can pre-book that into the scheduled calendar of programming.
So I guess, Sheila, the question I have for you is we're setting up an entirely new seniors housing unit with an entirely new executive team and governance model. Why are we doing this now?
Thank you.
So we are working with the Tenants First team in the City of Toronto and following the schedule and the path that has been set out by the city to implement the seniors housing unit. And the establishment of a region, the first region that Jill has spoken about, was part of the rollout of the seniors housing unit as contemplated by Tenants First.
Okay, so all right. I mean, I'm going to let. I've got some comments. I'm going to let Paula speak, or any other committee members speak, and then I'll make a comment, and then we'll move on. Councillor Fletcher.
Yeah, I'm going to refer this back to the Tenants First group. There's a board that's being formed, a new board. that's all happening. So I agree with you. We need to have an alignment. And I just think that that team should ensure that all of these pieces that are put in place are all the right ones. And as well, and I've been trying to get this organized for a while, but you know, I think everyone realizes how crazy our schedules are. I have done a comparison with this site and 80 Danforth for the number of police calls, the number of CSU calls, the types of calls that are there, and the level of difficult calls at 145 Strathmore is much higher than any of the other buildings that have been mentioned. So I just want everybody to know that. That's one of the reasons why I want to be very careful here, that we get the right location and that 721 be reviewed again. So
So you're going to move referral to the Tenants First Committee, and
I'm moving it back to the Tenants First at the city to make sure that all the steps are taken in the right way, and whether or not this should wait for the board to be established to make that determination and hear about this first step. Because once the board's established, then any issues with this site won't be coming back to this Tenant Services Committee. It will be going to the Seniors Corporation Board, Mr. Chair. So I just want to not, that's it.
Okay, and that also means a temporary suspension of the plans to roll out the wellness center in that building.
Well, I think once we go back to Tenants First and have that may or may not, but it would come to the, hopefully before the board meeting on the 5th, we can refer it for comment to there and then make a determination.
All right, so we've got that motion. I'll let Dara work on the wording, and I mean, I'll just comment that I think that the initiative is very worthy and very valid, and the intention is to improve wellness and to improve the health and well-being of seniors in the building and in the surrounding area. But I think I would be remiss if I didn't say that as the Tenant Services Committee, we have to listen to the deputants and try to have an understanding and appreciation of their concerns, and also and acknowledge that they may represent a wider concern other than just those that spoke here. I'm concerned about the loss of the recreational equipment. I'm not familiar with the building. I'm not familiar with all of what's in the building now and what's going to be lost, but I have heard what the deputants say, and I support Councillor Fletcher's move to take a second look at it. Any other comments from Councillor Nunziata?
Thank you. Just briefly, I will support Councillor Fletcher to refer it back, you know, to look at it. And the new board will probably be meeting very shortly. The members are going through council this week, the new members. But I support the intent. I have something similar in my ward, but it's not a community hub and it's not funded by TCHC. It's a seniors group that's been in a 1901 Western Road, which is Weston and Lawrence, for the last 25 years. And they rent the space from TCHC, and actually what they do is they provide programming, they do exercises, dancing, they provide meals, and the seniors that live in the building participate in it, and they're very engaged on it. So it's a wonderful center, and it does benefit the seniors in my building, but it's not the same as the hub that's being proposed here, where it's run by TCHC. This is a separate group that actually pays rent to TCHC and provides those programs for TCHC seniors in the building.
Great, thank you. All right, so we're going to move on. We're going to vote on Councillor Fletcher's motion. All in favor?
So can I I've got language that I think reflects the motion. Just before it goes to vote, I wanted to put it on the screen so that people can look at it and make sure that I've got the language right.
I think that encapsulates the intent.
Sorry, I think that
that's
some
right.
extra language.
Just a little grammar there.
Sure.
Mm-hmm.
Is that the committee's intent?
It is to get it back to the it's going to Tenants First. It's not a unit at Tenants First, it's the staff. Or I'd be to the DCM actually, to Juliana, to determine if it should be considered by the board of the incoming board of directors. And identify, I think that'll do it. And then we'll see if that's been cleared or not. I'm not trying to be difficult. I just know this building has had so many incidents there. So many fires, deaths, drugs.
Right. Okay, all right, so we're good with the wording of the motion. All in favor? Okay, that's approved. Thank you.
So we're then to item 9, and a slight change to the list of deputants. Ms. Dubé has indicated that she won't depute on item 9A, and I think we have 2 deputants who are going to speak to that item together as our next deputants, Ms. Snooks and Ms. King.
Okay, so for those following the agenda, it's page 142, the TCHC Community Safety Advisory Subcommittee update. And Veronica and Carol, you're going to go together?
Yes.
All right. Okay, so please proceed.
Okay, thank you. Well, hello, and thank you for having us here today. We are Carol and Veronica, and we are members of the DREAM Team. The DREAM Team is a group of people with lived experience of mental illness, addiction, and precarious housing. We use our lived experience to conduct and present research and demonstrate the life-altering benefits of supportive housing. So in 2016, we received funding from the City of Toronto to conduct research on housing unit takeovers. And this research resulted in a final report called Safe at Home, which is available on our website. A housing unit takeover, or HUT for short, is a situation in which vulnerable tenants are forced to accommodate unwanted guests into their homes to fulfill unmet social, economic, and personal needs. In the process, the tenant is threatened physically, financially, and/or psychologically. Housing unit takeovers are common amongst vulnerable tenants in Toronto, and may be led by organized groups like drug dealers or traffickers, or could be a family member or a friend from the street looking for a place to stay. Some tenants are serial victims, experiencing 3 or more housing unit takeovers. This is an issue that not only affects the victim, but the community as a whole, and should be addressed with seriousness.
So we recently worked with the Peterborough Drug Strategy to deliver home unit takeovers training sessions to frontline and housing staff across Ontario, which indicated the need for wider education on the subject. Previously, we have facilitated workshops with Toronto Community Housing staff to help them understand how to prevent and intervene in HUTs in the buildings in which they work. We have also been to Toronto Community Housing buildings and facilitated workshops for tenants who may be particularly at risk. It is important for tenants to be aware of home unit takeovers to avoid getting into these situations. Additionally, they should be able to identify the signs of a HUT to understand when it is happening to them, since in some cases the tenant does not realize their unit is being taken over. These workshops are key in helping tenants know how to protect themselves and their community. Tenants may be afraid to reach out for help due to the perceived consequences, or may not even know where to start. We have found that tenants walk away from our workshops equipped with new knowledge and tools to help them address some of these difficult situations. We are concerned for the safety of tenants and other stakeholders if they do not receive this training. We receive funding from the City of Toronto to create materials such as flyers and posters that can be put up in common areas of buildings to make tenants aware of HUTs. These posters are available in many languages to help them be accessible to as many tenants as possible. We think it would be beneficial to create new versions of these specifically for Toronto Community Housing buildings and the unique communities. We would be interested in working with tenant leaders in the Toronto Community Housing community to build rapport and understanding of this issue amongst the wider tenant population. Having previously worked with vulnerable populations regarding huts, we are uniquely positioned to understand the safety issues that go along with this work. This is a serious issue and anyone involved needs to be protected. There is much work to be done regarding huts in Toronto community housing, and collaboration with the Dream Team will and could contribute towards your mission of providing clean, safe, well-maintained homes for residents, fostering great neighborhoods where people can thrive. We invite you to visit our website to learn more about the Dream Team or email us at outreach@thedreamteam.ca. Thank you for your time.
Thank you very much.
You're welcome.
Thank you. That was good. Questions from the committee members? Okay, no? All right. So on the report itself, this is an update on the committee, the subcommittee that's going to be established. It mentions the members there and mandate. Any questions of staff? What's provided there? No? All right. So move receipt of the information.
So moved.
Moved by Councillor Fletcher, seconded by Councillor Nunziata. That's completed. All in favor? Thank you. Now we move along to the CEO reports. And we have 9, so the CEO reports, so we just have that one, sorry. The operational performance measures. Is that correct, Dara? Is that where I am?
Yes. Did you want to hear the deputants on the items 9C and 9D before we get into the remainder of the President and CEO reports, or do you want to go through them in order?
I think we'll go through it in order.
Okay.
Go through it in order. So on the performance measures, found on page 144 and then 140, 146, and so on.
Yeah, I have some questions.
Councillor Fletcher.
Thank you. This is a very comprehensive report. Just going to compliment you. Some questions here around some of the trends that we're finding. That's okay, Mr. Chair.
Please go ahead.
Around the vacancy rate, which is item number 4 on page 147, I'm looking at the vacancy rate by area, and I'm seeing that the seniors have a very high vacancy rate and an extremely high market vacancy rate. And I'm just wondering how we're, how do you determine that? Why? Not that report. It's the next one, the next page, Mr. Chair. Page 148.
So, Mr. Chair, Jill Bada could comment on the specifics around the seniors housing unit at a high level. Due to COVID, we understand that it is difficult for the seniors housing unit to offer units to prospective tenants. There's some hesitancy to bring outside members from the public who may be potential tenants in to view units, but I know that they're starting to trend down from a high at the start of the year, 2.96 to 2.67, so they're moving in the right direction, and I know it is a priority for them. Jill, I don't know if you want to add anything.
Thanks, Sheila. Yeah, that's correct.
Could you,
Sheila
sorry, could
indicated
somebody put up the proper page? It's page 148.
Next page.
Thank you. That's it there. Thank you so much, John. There we are. There we go.
Yes, so as Sheila identified, our biggest obstacle over the last year or so has been certainly COVID. We've had a hesitancy on the part of a lot of potential tenants coming to view buildings and coming into seniors buildings. We have had a rapid action plan around reducing our vacancies, as Sheila has identified, that has brought our number down, but we still are targeting a continued reduction in the vacancy rate for seniors. It's moving in the right direction.
Okay. I think obviously that'll go over to the Seniors Corp. I don't know how many units that represents, but so that's fine. Thank you for that answer. I appreciate that. then page 150, if you don't mind taking that, scrolling whatever direction you're scrolling. And there we go. Thank you. There's 150. So this is the non-rentables. And this is the Revite units are being held for 1,484 units. And I have no idea how many tenants that's covering, from which revitalizations that's covering, and how many tenants are in each one. Can I get that information, please?
We can provide that for you.
Yeah. Thank you, John.
Are you going to provide that now, John, or you grab that?
Councillor, I can send it directly afterwards. I don't have the data points offhand, but I'm sure I can get it for you.
Okay, so I just trying to see if there's 1,400 units. Are there 1,400 tenants that are waiting for new location under revitalization? And I think we realize just how generous TCHC is around relocation when we're rebuilding, dealing with many, many tenants whose landlords are just kicking them out onto the street. So I'd really appreciate that. I think it'd be helpful for the board to have that too, John. So that'd be perfect. And around the repairs required, I'd like to know the length of time that each of those are vacant. 425 is a lot of units. So how long have they been in this state? I'm sure you don't have that right today. I think I'll ask these questions, Mr. Chair, and maybe we can have this information as a supplemental to the board, because that would probably make sense to me. And that the length of time, so is it 2 months that there's 425, or have some of them gone back? Because I think we all realize that these are precious, precious, precious resources with so many people looking for housing. We cannot build fast enough. We're building modulars. We're only building 50 at a time. That basically is kind of 10 or 8 modular housing units. It depends on how long they've been out of service. So I think the board should understand that. On non-residential use, I just want to understand that policy where what size of buildings or what size of communities would end up with a discrete unit that is for tenant activity, particularly giving the housing crunch. I think I'm just asking for that. I'd like to have that answer back for the board. And then under legal, I guess, is this the single family homes here that we're talking about, or what are those, please?
I believe so, Councillor. I believe they are the single family homes, but I can reconfirm for you as part of my overall response.
That
would be helpful, because when people look and see there's 2,300 vacant apartments and we're having very big difficulties in communities establishing even 50 units, I think that our board has to make sure that we have the best use of our units. Those are my questions, Mr. Chair.
Okay.
Except for page 154. Because I think this is, I asked earlier to have some more detail, and I just want to thank you, John and Sheila, for providing that. Very much appreciated. This is the famous false alarm that we've asked for by building, and the amount of money, of course, it's a lot. I've gone through both lists and seen that 8 buildings that were on in 2009 don't appear at all in 2019, don't appear at all in 2020. So for those buildings that have been successful, I'm really interested, John, on what's the success factor there. Some of them were closer up to the top, and they've successfully been dropped from the top 20.
Can you identify those buildings for staff?
I have them on a piece of paper, but I'm just going to ask for that for. Yep. Because there's 8 on and 8 off, that would just be helpful to get that bit of supplemental information. And then there are 8 new ones on the 2020 list. And a number of these are also VRP buildings. And I'm interested to have those identified in that way, or in the clusters. So just in dealing with this large amount of money, $1 million a year, or 1.3 a year, 1.3 a year. And I know everybody is trying to find the ways to reduce this. So finding out what was so successful with the 8 buildings, maybe you've found the magic solution. Understanding in the VRP buildings, what's the approach around the false alarms, and could we come up with something that might be better? And how did those 8 manage to get on there? And then some of these have shifted places. They used to be at the bottom of the list, and now they're further up. But
okay, so Councillor Fletcher, if you could provide that information to staff on those buildings that you've identified.
I think I just did that myself. I think they.
Well, that's valuable information.
Pardon me?
I said that's valuable information that you did yourself. Just if you could provide
8 and 8. Yep. Okay, I'll find it. But I'm sure John's looking at that right now and just doing a visual up and down. And then we see that some of them, like 1901 Weston Road, it's gone from the middle to the bottom. So let's just look, and some of them have gone from 275 shooter to 85 shooter. It's just the trends and how we're managing these, because we've
and some of them are persistently bad.
And some of them, the top 2 are still the top 2. And so maybe we need a different approach there. I'm going to suggest that if those are VRP buildings, we might need a different type of staff in there. If we could save what is $400,000 or more in fee, no, sorry, it's $200,000. When you add some of the other ones in, there might be more of a medical model like we're looking at with the non-police approach to mental health. There might be somebody there that would be able to assist us in a different model, Mr. Chair, but we just have to see the facts first. Thank you so much.
All right, thank you. So, all right, Sonia, if you could take that down, that visual, and I could just see the rest of the members of the committee. Any other committee members have comments or questions? Okay, seeing none. Okay, need a motion to receive the operational performance measures. Moved by Councillor Fletcher, seconded by Marcel. All in favor? Okay, thank you. Now, I am mindful of the time. It is 11:27, almost 11:30. We've got a few items to go through and some deputations. We now move on to the tenants complaint update. And we have a deputant on this, Kathleen Dubé.
Yes, hello, good morning, everyone. I am doing a deputation today on item 9C, tenant complaints update. Acknowledging standardized training provided to the solutions team in April of 2021. Acknowledging the existing digital divide, who that disproportionately impacts and why. 55 tenants participated in 4 tenant engagement and consultation sessions. I was privileged to have participated in one of the 4 sessions on Wednesday, March 31st, 2021, from 6:30 to 8:30 p.m. through WebEx. I want to thank our TCHC community for holding space to listen. Building a culture of respect, care, and helpfulness will take time. Acknowledging the feedback collected during the consultations will be reviewed and integrated into the refresh of the TCHC complaints policy projected to TSC in Q3 of 2021. The fact that complaints have increased year over year to both TCHC and the Toronto Ombudsman have raised the need to further investigation and advocacy. Several communications have been sent requesting changes made to existing policies without a respectful nor responsive system. Suffice it to say, the interplay between tenants' valuable feedback, data collected including other forms of trends, and existing fairness play a pivotal role in how we action things like anti-Black racism and other forms of discrimination and or violence. What does the data say? Well, 25%, 51, antisocial behavior. That may be ambiguous. How are we redistributing power? When will our communities lead? The implications from what is implied in today's deputation is unacceptable for the City of Toronto. A city known for diversity, and yet the mindset, narratives, and the heart of the matter have yet to be actioned accordingly. Acknowledging CCC's unique role and the work towards centralized systems, please consider making amendments to timely emergency accommodations to tenants, access to real-time service disruption info, effective managing community human rights complaints, integrated team approach to community safety. Contingency and emergency planning advocacy was sent several years ago via email without acknowledgement or response. A responsive system with respect and urgency in accordance with appropriate governance and oversight. Acknowledging TCHC isn't governing human rights complaints. Implore TCHC and the City of Toronto to integrate systems that educate and empower communities, especially where disparities exist, which will shift from status quo into a sustainable way. Acknowledging the ongoing work of TCHC and the City of Toronto that you're undertaking is quite brave, and that the brighter future needs to include budgets prioritizing this work from an equitable lens. Thank you so much for your time.
Thank you for your deputation, Kathleen. Questions from committee members? All right. Seeing none. On the report found on page 156, Councillor Nunziata.
I'll move the recommendation.
Okay. Moved receipt. You've moved receipt of the information. Can we take the visual down, please, so I can see the board? Thank you. All in favor? Okay. Thank you. Okay. Next item is the tenant engagement update, refresh update, and we have one deputant on that.
Mr. Avila, I believe, is on the line.
Mr. Avila. Miguel?
Yeah. Yes, hi. It's me again. Thanks for the opportunity to speak on 1990 tenant engagement refresh update. So I am very glad that this report is coming today because it addresses some of the concerns that I have as a tenant rep in this community. I wear different hats in this neighborhood in Regent Park. One of those hats that I wear is Regent Park Neighborhood Association, and I also am a member of the Coalition for Community Benefits Agreement in Regent Park. So being a member of these two organizations, over the course of the COVID-19 pandemic, we have lost members. Some members have decided to move on, and from both sides, from the resident side and from the tenant side. So we have coordinated now an ambitious plan to recruit members to fill in those gaps, those empty seats at the Regent Park Neighborhood Association. But we have been held back because the tenant engagement process has been delayed because of COVID normally, to expect that, but also because of other issues in aligning the Regent Park model that I think I brought this to the attention of the board to William Mendez and other staff here at Regent Park with regards our previous CEO who ordered to implement a pilot project in Regent Park. And so this delay has been the reason why we haven't been able to have tenant elections in Regent Park. From the tenant side, we need to have more people to join us. Also, we are wanting to coordinate the same process that we had with TCHC back in 2018 when we had the last elections, I believe, or I could be wrong, and we recruited the members from the TCHC side and the tenants from the condominium side to join us as one Regent Park. So I'm curious to ask you two questions. Maybe someone can ask Julio Rodriguez if he's in attendance. It's in regards to page 19, phase 2 status on the recruitment process for properties listed on page 19. I'm talking about the properties listed as tax bill 230 is one of the units in Regent Park. I want to confirm with Julio if this is part of the plan to have elections in June 2021. But I noticed that there are some buildings listed on page 24. The third phase number 3 of the tenant engagement process, which the elections have been scheduled for November of 2021. So I want to ask someone from the committee to ask Julio Rodriguez if the buildings listed on page 24 is what I am concerned if the south buildings indicating as part of Regent Park are also part of the buildings that need to hold elections. It's on paragraph, it's on column number 1, 2, 3, 4, 5, 6 of the report on page 24. It says Southwest Buildings, South Regent Park.
So Miguel, so,
yes.
So the deputations are not really the place to be making questions of particular programs to staff. I think you'll need to do that as an aside, sort of offline, as it were, directly to the staff that you're in touch with.
Exactly, and that's what I want to say is that we want to have elections in Regent Park once and for all, because we cannot prolong this deficiency by TCHC by not providing us with an exact time and a schedule to conduct TCHC tenant elections. We want to work together in Regent Park. We have signed together $28.1 million for the CBA agreement, but we want to see your cooperation manifested promptly so we can have tenant elections with residents from the condominiums who want to join us as well.
All right. Okay.
You understand my point? What I'm trying to get? You understand what I'm trying to get?
We do, and
right.
thank you for your deputation.
Okay. All right. Thank you very
much. Thank you for your deputation. Thank you. I don't know if anyone has any particular questions of the deputant. No. Okay. Sheila, maybe we could have somebody address his questions to Miguel. You're on mute. Sheila, we can't hear you.
Mr. Chair, we will follow up, and thank you, Miguel, for your deputation.
Got it. Okay, that's perfect. All right. And so are there questions on what staff has reported here? Okay, I don't see any questions. Have we lost Uba? I don't know if we've lost Uba. Okay, we still have quorum though. All right.
Yeah, I do actually have something that was
Oh,
from
you
the
do?
minutes.
I'm here,
and now
John, sorry.
Oh, you're there. Okay, Uba.
Is Uba there?
Right.
You found Uba?
Yep. Okay, Councilor Fletcher. Yeah.
Found her online. Just this situation that I'd raised earlier about the minutes, having in there the participatory budget. And I would just like that to be held so the board can understand that a little better. We heard about the exercise equipment as part of participatory budgeting. I think we need to understand what we mean by participatory budgeting, or if there are goods and services that are offered to tenant communities, which is different than an understanding of what really PB is, which is vying to select different things. Whether you're ordering out of a catalog, that's different than participatory budgeting. So I don't know how you'd like to handle that part, Mr. Chair, under the tenant.
How is that related to this report?
Because it's part of the minutes from the last time. It's part of the tenant refresh. It'll be brought back as part of the tenant refresh in 2021.
So do you have a motion that you'd like to make?
Well, I'd like to make a motion that that the participatory budgeting plan be brought to Tenant Services Committee prior to its implementation.
All right, so that's sort of like business arising out of this. All right, so why don't we we'll move receipt of the report. Moved by Councillor Nunziata, seconded by Uba. All in favor? And then arising out of this, you have a motion on participatory budgeting.
I think Dara may have captured that.
So I can consolidate it into the single motion to receive this report with an addendum to it that the participatory budgeting plan be brought forward to Tenant Service Committee prior to its implementation.
Thank you.
That sounds
perfect.
all right. All in
Perfect, Dara.
agreement?
Thank you.
Okay, all in agreement. Okay, that's moved and passed. All right. Next item is E. 9E, update on the use of shipping containers at Lawrence Heights. And I'll just ask if any members have questions. Councillor Nunziata.
Just one question, because we were receiving a number of letters previously on this. Does this address the issues that the tenants had at Lawrence Heights as far as the space?
Yes, it does, Councillor. It's providing for space for tenants to use for community activity, as was suggested by Tenant Services Committee.
Okay, so I'll move the recommendation.
No, I have something here before we do that. Yeah. I think this is very exciting and could be a new dawn in Lawrence Heights. Those of us who go by the corner of Bathurst and Dundas regularly see what Scadding Court has done with the containers, and it is real community economic development. There's little restaurants and everything. I would just like to add on here that because Scadding Court is a city-owned agency, it's an AOC, that this program, that they be requested to assist with the containers. I think it would really add a dimension. They've worked with those for a long time. Basically with the Alex Park community, that's the Scadding Court is very connected to Alexandra Park. And I think, Sheila, that would be pretty exciting as far as an initiative is concerned. Do I need to make a motion or to ask that? It talks about getting help or an agency. I think that's the agency that, and it is city run, so it doesn't have to be an RFP. It can be a direct relationship there.
So, Mr. Chair, we'll reach out to Scadding Court. We know that program well.
Okay.
Great. And maybe when we're at the board, you'll be able to say if if they're able to assist in some way. If not, then back to the original. That would be great. Thank you so much.
Any further questions?
No, I'd like to. Francis is moving it.
I have a question. So a question about this. This involves the expenditure of $250,000. Is that correct?
That's correct.
And we're doing this before we've made a request for applications. So we're going to seek people who will, organizations that will make use of the space, but it looks like we're making all of the arrangements for the space prior to seeing if anybody's interested in the space.
So my understanding, Mr. Chair, is that there is a long-standing list of individuals and organizations that have been prioritized by community who would take advantage of this space.
And will they be renting the space, or is the space provided at no charge?
So it's a 6-month pilot. So we will explore that with these various agencies and groups, including Scadding Court.
So is this one shipping container?
So we've identified 2 preliminary sites, and we'll be moving ahead with a 6-month pilot.
So this is presented as for information rather than approval, and I just don't know, was the 250,000 already budgeted?
So we have that budget within an existing program line within the budget, and our feeling was that we needed to pilot this, to test it in community for 6 months, and then report back to tenant services on the effectiveness of the container project to see if it is something that we want to host long term.
So shipping containers, as I've seen them, are made of steel, and they have 4 walls, a roof, and a floor, all made of steel, with no windows or ventilation. Is that what we're looking at here? I don't understand.
I'll ask John to speak to that, but I have had personal experience with shipping containers, and they can be modified to suit the program that's going into them.
Actually, Mr. Chair, I know that Jessica Hawes, who's the Senior Director of Development, and Alan Murray, Facilities Management VP, are online. They can be better placed to answer your question in terms of the specs of the containers.
Sure.
Hi,
thank you, John.
Sorry, go ahead, Alan.
Oh, either way. Yes, as they noted, the containers can be modified in many different ways. So you're correct that a shipping container used to ship something is simply a box made out of steel. But when they modify them, they add doors, windows. They can be outfitted for office space. They can be outfitted for food. To make a small pop-up restaurant, for example. So they can be basically modified in any way that's needed in order to accommodate what they're going to house. So there's many options.
So are we looking to acquire shipping containers that are already modified, or are we looking to acquire an unmodified shipping container and then incur the cost of modifying it?
We would look to have one that has been modified. So the first piece, as we've noted, is to identify what will be programmed from the shipping container, find out the needs. They can come in various sizes. So we'll find out the needs, and then we can look to, there are a number of companies, and as Councillor Fletcher has, indicated with Scatting Court, they're very well aware of all the different options that are there, and we can look to find one that's been modified that meets the needs, or there's many companies that will modify it to meet your specific needs, and then we'll look at, where we go from there.
So if I'm not mistaken, there's a local high school that's right in the area. Is it John Polani Collegiate Institute? Is that a TDSB open school?
Yes, it is, I believe.
And does it have excess capacity? Have we looked at that?
So there is a note in the report that says that space hasn't been available, that we haven't been able to get access to space in the school for community programming.
So have we engaged a discussion with the Toronto Lands Corporation or with the TDSB about that particular site?
Jessica, can you speak to that?
We haven't. We've had ongoing conversations around space at Lawrence Heights and around the opportunities for our partners to start to contribute to some of these uses, specifically, the location of the food bank and a lot of the driving needs that we know are in the community right now. We haven't had successes, but in the report, we do identify a need for creating those partnerships with TDSB going forward. Because we know that the shipping containers won't meet all the needs of the community, and there will also be other sort of program needs that we would want to establish those strong relationships to deliver space on.
All right.
Mr. Chair, to answer your earlier question, is 3 8x20 shipping containers for 6 months.
Okay. Well, all right. I mean, I'm just skeptical about, what are we going to do with them after the 6 months? Will we have to find new space? Will we lease them for longer? Have we looked at all of the other options in the area, such as the location that I mentioned? just a lot of questions, you know. I'm prepared to, you know, let it go and maybe just stay on top of it. I don't know where the idea came from of using shipping containers to.
Me.
Thanks, Paula.
It could be really exciting. Let's try it.
Yeah, but I mean, you've got a whole raft of problems, and then you're going to have to heat the place in the winter time, and you're going to have to air condition it in the summer, and
Let's find out what they do at Scatting and how they run all of that.
all right. So we'll have a motion to receive the report for information. Councilor Nunziata, all in favor? All right. All righty. Next item, and there are no deputations on this, legacy arrears collection performance measures. Do we have any questions on the staff report from members of the committee? Okay, seeing none, can I have a motion to receive that information from Councilor Nunziata, seconded by Marcel, all in favor? Okay. Next item is the violence reduction program, which we've spoken about earlier. We probably should have combined the two together. Do we have questions from committee members on the report? Page 214. Questions? No. Then actually, the notes that I have made are sort of replicate what Councillor Fletcher mentioned earlier about the overall budget, and so now I know that we're going to be looking at that. And I did have a specific question, seeing as there's none from the other committee members, on G4S. It makes mention that the security guard.
What page?
Oh, page 218.
Thank you.
It makes mention that the security guards cannot travel between communities. And so as a result, we have to hire more G4S security guards.
So, Mr. Chair, I know that Bill Anderson's online, and I know that he can respond to that question.
Okay.
Yes, Mr. Chair, under the collective bargaining agreement, the difference between operations with special constables and security guards is very distinct. And security guards are used for static locations and patrol within buildings, as opposed to special constables used to patrol communities. The vast size of many VRP sites do not allow us to use singular or paired security guards in compliance with the collective bargaining agreement, nor the ability or the capacity of a special constable. Therefore, for example, if you have a split site such as Jane Falstaff, you need to place physical security guards at each location to have a security presence, whereas the special constables are mobile and do repeated patrols.
Okay. Another question I have is on page 219. It says Toronto Police cannot proactively enforce Trespass to Property Act. Why is that?
So in the first quarter of the year, the Trespass to Property Act authorization letters issued to the Toronto Police Service expired. The CABR report was tabled and approved, which included a portion regarding Trespass to Property Act letters of authorization, and they're being issued. And accordingly, we're now undertaking a review of the process for the issuance of those letters and the Trespass to Property Act. And we are coming together, working with the CABR team on that, and are working with the Toronto Police Service as well to move forward on that topic.
So John, Mr. Chair, just to be clear, if a TPS officer is on site and has questions of an individual that they encounter on site and they need to trespass them, they would contact site staff to have an agent of the landlord, like the superintendent, or they would call CSU if they needed to enforce the Trespass to Property Act. So that's something that we're looking at through the Community Safety Advisory Body, how and when and if we reinstate those letters with TPS.
Okay. All right, I don't have any further questions that need immediate attention. All right, so we'll move.
Well, I have something on page 220, because now we're back at the fire. We've got the fire info for some of the VRP sites, and 220, 221, where in 2020, six TCHC buildings located in 3 VRP communities were represented in the top 20 list, down from 7 in 2019, but we still have 6 in the top 20. And I don't know where the right place is for that. I mean, there's 78, 73. We saw the dollars that are attached there, and I'm just not sure that within this, I'll think about it between now and the board, but I'm not sure that we have in these particular locations the staff component that deals with the tenants. That these are very difficult buildings of a particular nature, and we may think about shifting the focus from all CSU to more of, I'm just going to call it a public health nurse or approach, a different approach in these particular buildings, and adding on a staff component of that nature. Because as I've said many times, we have different types of buildings. We have ones where we have these are extremely vulnerable tenants in this location. They are. I'm getting the nod from our acting COO. They're extremely vulnerable tenants with a lot going on, including some of the unit takeovers, many things of that kind. So maybe we just need to be thinking about what is the staff component to best deal with those folks. And it might not be what I'm just going to call overall complete policing model, which is TPS and CSU. So I'm going to float that here and come back to that at the board, Sheila and John, because I know I'm planting that seed right at the moment. And these are good indicators. Yep.
If I could, Mr. Chair, through to the councillor, that seed has been well planted, and the Community Safety Advisory Committee that we've talked about earlier in this agenda, that as we develop the terms of reference, committee members develop the terms of reference, I am sure that that will be front and center in that committee's work.
And I think if I can, one more thing, because you kept us on track. Very good, Mr. Chair.
Trying to, Councillor Fletcher.
You're doing a good job. You're doing a damn good job there. That when we get the breakout of the buildings that I see is coming for the June meeting, which is, here's buildings that are mostly highly vulnerable tenants with deep vulnerabilities. Here's communities that are racked with gun violence and violence. Here's communities that have the odd problem, and then here's the stable communities out there. We're able to think how we're going to deliver services and do certain things across those types of buildings. Okay, thank you very much.
All right, so we'll have a motion to receive item G on the violence reduction. Okay, moved by Councillor Fletcher, seconded by
Marcel.
Uba. Okay, all in favor? Approved. Great, thank you. Now, the last item we have is the Q1 2021 tenants first update. We have 2 deputants, and the first is Anita Dressler. Anita, are you there?
Yes, I am. Good afternoon.
Thank you for hanging in.
That's all right. It just turned to afternoon, so I'll say good afternoon rather than good morning.
Right. Good afternoon.
Good afternoon, Chair, Ms. Penny, and other members of the committee. The tenants' first presentations held at the end of April indicated certain things that made it appear that senior unit of the 83 buildings will not be fully established for nearly 2 more years. In the meantime, it is incumbent on tenant services to include us, the seniors. So far, we have been left out. Our engagement and funding is nil, partly because of COVID, but mostly due to the fact that Refresh is geared for youth and mixed buildings, and staff had not put their energy towards helping us, but only to the aims of the youth. Tenant services should be for all tenants, and that means including us. You are all intelligent people. You would not accept youth having input on your future and ignoring your needs and wants. You would want input of the planning and the impacts on your life. Tenant services should be thinking of two systems: Refresh for youth and family or mixed buildings, and the second system possibly called Senior Services for the 83 senior buildings soon to be severed. To date, you are passing and encouraging systems that show seniors that we do not matter and will not for nearly 2 years. This is proven in the statements of Tenants First and Refresh. We have been left in limbo. What is being set up leaves many fears, whether it be the ISM negotiated for Southeast Scarborough or what is going to happen with OACH. The model for the ISM is wrong. It gives a perception of one size fits all. But one size does not fit all because of the diversity of our city. Each area, each building has different needs and wants. We, the tenants, mostly advocates, have given you this information for years, but no one listens to us. Staff just plow ahead thinking that the original plan is the best for all tenants, but it certainly is not. Double talk has been given regarding OACH. Many of you recall OACH was created for the seniors unit of TCHC to avoid evictions for rent arrears. Instead, now there's a 2-year agreement to allow OACH staff to help seniors, and afterwards, it is up to the city to devise something new. Approximately 1 week ago, this was emphatically stated by Tenants First at their 3 presentations to tenants. Tenants in family and mixed buildings will and are the recipients of this valuable service, OACH, and protection to tenants in need. Once again, you're leaving nearly 15,000 tenants in limbo. We are still your tenants. Therefore, we should get the same treatment as youth, family, and mixed buildings. You have forgotten the charter. Patricia Noreen and many tenants, mostly seniors, worked long and hard for the values written in the charter. Your Refresh and Tenants First have many erroneous statements, and above all, ageism is written all over it. The charter states equity, equality, and respect. Please start to include us and follow the 3 sections of the charter. Thank you for your time and your indulgence.
Thank you, Anita. Any questions of the deputy from members of the committee? No? Seeing none. All right, thank you. Next.
Mr. Chair, I'm just not sure that the OACH is going to be nested at TCH while the Seniors Corporation is developed. I'm not sure that there's any thinking that would do away with the OACH. I just wanted to clarify that, not that I know of.
Thank you. As I recall, the way that we used to do that at City Hall was, are you aware that, et cetera, et cetera. I remember.
Aware.
Are you aware? Yes, I do recall that. Yeah. All right. Now we have Mr. Bill Lohman returning with a commentary on the Tenants First update. Mr. Lohman, are you there?
I am.
Great. Well, welcome back.
Thank you very much, and good afternoon, everybody. I think as a recently announced transfer of OACH and the complete severing of Toronto housing in the seniors community clearly shows, is that, all these compartments of senior housing, the governance, policy, protocols, and supports like OACH are going to be reviewed and redone. City staff, Toronto Housing, and the SHU ISM management were all consulted and involved in the calls for action brought forward. Tenants were notified 7 days before the council votes and given no prior knowledge or input to the items or voice on the long-term implications of the actions Tenants First has advanced. Why hasn't the Seniors Tenant Advisory Committee been included or even alerted about these critical issues? The goal and expectations of Tenants First and staff for the integrated service model are clearly different from what seniors want, need, and hope for. In fact, the role of seniors in this integrated service model is that of a customer only, not a participant, and certainly not a stakeholder in the design of their own living in place future. Notwithstanding the inconveniences and devastation that COVID-19 has brought on all our lives, the underserved senior population in the 83 buildings have experienced a virtual vacuum of communication silence about their housing future since 2019 July. And all senior councils were shut down and disbanded by Tenant Services on July 1, 2019, confining seniors to their communities and being isolated from other communities, barring a free flow of communication and exchange of information. Why are seniors being denied the same level of participation and voice in relevant decision-making for the seniors integrated service model that Toronto Housing Youth have enjoyed all throughout the development process of the youth engagement refresh pilot for the family buildings? Do you not see a double standard between the privileges and approach used by Tenants First to inspire and empower the youth compared to a outright disregard for seniors' concerns and a wall of silence around the communities? It has left seniors isolated, dejected, uninformed, unaware, and voiceless while we sit there and watch the refresh and the revitalization just moving along apace. You know, let's be clear. Without the input or knowledge of seniors of the 83 buildings, you are making decisions about communities where you don't live and where you have no understanding of the lived experiences or needs of the tenants that you're making decisions for, especially because those tenants have been muted for more than a year. The past silence of the Tenant Services Committee to provide honest answers to seniors' questions amounts to a tacit complicity in a scheme that deprives seniors of their right to know and be involved in deciding their future engagement with the same level of staff support and the same degree of professional assistance as has been provided to the youth and family buildings. It is tantamount to discrimination against senior tenants in their best interests. It is ageism. Do you honestly feel seniors have been treated with the same respect and consideration by city staff and Toronto Housing as the youth and family buildings have? Transparency and a voice. That's what seniors need. We'll work with you. We want to work with you. But it's hard to work with anybody when you get no answers. Thank you very much.
Thank you, Mr. Lohman, for your deputation. Questions from members of the committee?
Just say, Mr. Lohman, you're on the stack, are you?
Excuse me?
You're on the stack, the seniors.
Yes, I am. I am a member of the seniors.
What's the full name of it?
The Senior Tenants Advisory Committee.
So you've been named to that. The TCHC and Tenants First has a Seniors Tenants Advisory Committee to work on the seniors portfolio. Is that correct?
That is correct.
And so I think it would be helpful for you to recognize that that's very special. That wasn't set up previously. Youth don't have anything of that nature. And your voice, you have a chance to make your voice heard there.
Well,
whether or not you get everything you need or want, you still have a chance in a way that others don't actually to participate and give advice. That's my understanding of your role.
Well, I guess that, yes, I guess that might be your understanding. I am not speaking just for myself on this occasion. I am also speaking for other seniors
That's fine.
who have not heard.
Yes.
The reason I know things is because I go looking for them and find them. Many seniors don't have that ability. Okay, and in regards to the silence, I'm speaking to this committee in regards to many deputations that I and other advocates seniors have given over the past 3 years in regards to the refresh and in regards to the way we have been treated by Tenants First. And so I'm very glad, and I'm happy to be a participant on the stack. And I'm very, as you know, as I mentioned earlier, I spoke with Jill yesterday. I'm speaking with Julio tomorrow.
Thank you. Yep. Thank you. I'm going to ask Mr. Chair. I want to know more about the stack, the role of the stack, how people are on the stack, what is their requirement.
So thank you, thank you for the deputation. Appreciate that. And then we'll move on to questions from the committee now on the process and the report itself. So Councillor Fletcher, you've got some questions?
Yeah, I'll be looking forward to hear a little bit more about that and what's expected of the members, what was put together. And I certainly don't think that there's silence by the committee. There's a process for Tenants First and Seniors Corporation to provide services to seniors. And I fully expected that people were on the stack in order to assist and give advice. So I do appreciate all the time that people have put onto that. I don't need to hear that right now. I can get that separately, but obviously we have a member of that committee that doesn't feel that either that committee or TCHC or in any way reflects what they think. And that concerns me. Either the committee's wrong or the deputant doesn't understand the role of the stack and their role. So either or.
All right. And Sheila, I didn't know, did you want to make a comment? You looked like you might want to just chime in.
Well, I do understand that staff was formed through quite a lengthy process to bring the seniors' voice forward in developing the integrated service model. And I know we have Jill Batta on the line. We have Lindsay Dietz on the line, who are Jill is the general manager of the seniors housing unit. Jill, did you want to address the councillor's questions on staff?
I don't know that she's there.
I don't think,
I'm here.
I think
I apologize.
TCHC
I was double muted. I apologize. Apologize, Jill. Sorry. So as many are familiar, the Seniors Tenant Advisory Committee was created out of the Tenants First initiative. The membership of the committee was firmed up last December of 2020. We've had 6 meetings since December. We meet every 6 weeks with that committee and go through a variety of items. Certainly, as you can imagine, as we started the committee, there was some general housekeeping things around kind of the rules of the committee and those types of things, but we are well underway in terms of having conversation about some key items of interest. The item that Mr. Lohman raises this morning around engagement and seniors engagement in particular is one that we have on our agenda because we do need to do some more work as we all get ready to go to the Seniors Corporation. We are working currently with Julio's team in the transition of engagement staff so that we can work on focused tenant engagement around seniors as things move and progress with the integrated service model and the transition to the corporation. But the committee does have a standard running agenda of items, many of which are raised by the members of the committee as items of interest, and some, quite honestly, that will take some further conversation. But either way, it is a forum where people can bring their own views or the views of fellow tenants to share feedback and input, as well as we've created other ways for tenants to reach out to the committee members to provide input.
Okay, thank you for that. All right, so given that there's no further questions and given the hour, I think what we'll do is we'll ask for a motion to receive the information. I'm sure we'll have this discussion again. Moved by Councillor Nunziata, seconded by Marcel. All in favor? And that concludes the meeting. A motion to adjourn is always in order. Councillor Nunziata moves adjournment, seconded by Marcel. All in favor? Thank you very much.
Thank you.
Sheila and staff.
Great
Thank you,
week.
Sarah.
Bye.
Thank you.